by NAC, and NAC has its head office in Bengaluru, and we are actually in a process of assessment of over 1,000 universities and more than 45,000 colleges. So it's a very big establishment of the government, and therefore I am saying that the reasons are in the compromised education system. Whatever we may say about Lord Macaulay, but I must admit that he was one of the most intelligent person, who recognized that if you want to really break India, you will have to break their culture, you have to break their language, you have to break their, including medicine also. So you break their everything, and that he did very, very efficiently through education. So while even we got educated from schools or colleges, on one side, while we were learning about Archimedes' Eureka, Eureka, or we may be using, reading about how great the science, they were great scientists, there is no doubt about it. So Newton, Galileo, we all studied them. But we did not study Panini, we did not study Charaka, we did not study Sushruta, we did not, in fact, the mind was shaped in such a way that we started looking at it with suspicion to our own cultures and our own knowledge systems. The Sanskrit or regional languages or local languages, were compromised in education tremendously. So English has become a global language, so we have to go with English, there is no question about it. But not at the cost of our own culture, not at the cost of our own mother tongue. Even today, I come from Pune, Maharashtra, Even today, while I have traveled all over the world, when I read in my mother tongue, I understand it much better than standing in English. And this is the value of mother tongue, which has been now rightly recognized by the National Education Policy 2020, which is now talking about education. What education? Not education is just merely for getting some degree, The Gurukula, what you made reference to, Dr. Pillai, Gurukula system actually, and which was practiced for Ayurveda right here, in terms of your Pathashala, the name itself, Pathashala, speaks a lot, So that kind of a education, and I still remember the kind of education and the students who have come out of such Gurukula system from Kottakkal or from Coimbatore, they have their mark. You can identify them, that they have come from these schools. This was the power of our education at one point of time, which we institutionalized, what you said. And while institutionalizing, the impact was the colonial impact on our mind. So we started ignoring value of Sanskrit. Reading original text in Sanskrit is something very different, and which I lack, because I did not study Sanskrit in my school. They did not teach us Sanskrit in our school. If I would have known Sanskrit, I would have done much better work in Ayurveda. That's what I feel today. And there are very few people like Dr. Rama Jayasundar, whom you will listen, who after even getting highest degree in physics from top university like Cambridge, enrolled herself in a full-time Ayurvedic course and became Ayurvedic Vaidya, You will listen to her later. Or Dr. Tanuja Nesari, who is now heading India's aims for Ayurveda, which was created. So Dr. Pillai, you have raised so many points. So actually, I would have liked to talk on each of the points, but I'll just pick up very few from them, because your speech was very, very power-packed and very thought-provoking. First, I will talk about, what you mentioned about the reports and policies. Somehow, Niti Aayog had recently appointed a committee. I was co-chair of that committee. Both Dr. Rama and Dr. Tanuja are members of the task forces of this committee. This committee is chaired by member health Vinod Paul. And the mandate was integrative health. And we have actually prepared our report on integrative health. When you are in India, when you are studying medicine in India, how can you become a doctor without having insights to Indian medicine? And this term India also, I don't like to use, because the moment we say India, we start thinking 1947 onwards, But we were not born during that time. We have thousands of years of history. So Bharat or Bharatiya Parampara, Bharatiya Jnana Shakha, our own knowledge systems, and Ayurveda is just one of them. Chauda Vidya and Chausashta Kala. That's what was the dream of people like Krishna Kumarji or Dr. Warrier, that the new universities should be such that where this kind of education, Chauda Vidya and Chausashta Kala, should be taught to. Now, how many of these kalas are even existing today? We may not have even heard many of these Chausashta Kala. So, Takshashila and Nalanda, they were the global universities where all this was taught. And we have lost that. And not only we have lost that, somehow this colonial impact is so strong in our mind that we have started ridiculing our own culture. But this is something very, very serious, And the very few places, I would say, where a systematic counter has happened is Kerala. It's not only because of the Marthan Varma fought tooth and neck to defeat and protected this region, but because these traditions and cultures are living today, existing today. I was so happy, Dr. Warrier, to visit your family house and see all the Warrior family sitting here. And it was an entirely different heavenly experience to have a meal with all of you, the homemade meal with all of you, on a banana leaf, arranged everything systematically, on which side the pickle should be there, on which side the rice should be there. So this is what is our culture, and we are losing it. So the centers like Arya Vaidyashala, Kottakkal actually are like peaks of excellence, Not only you have protected your culture, but you have also adopted the modern science. When I went last time to the laboratory of Dr. Indira, I could see that the kind of work which they have done, advanced chemistry, advanced biology, molecular biology. And I must tell you that Ayurvedic biology, what you mentioned, Dr. Valiathan has already championed it, So there has been a very large project which is now sponsored by Government of India, coupling to few hundred crores have been invested. And you put a question mark, what happens after the use of Rasayana? I would suggest that, that question mark can be removed now, because now there is a sufficient evidence with us that after Rasayana therapy, what happens to your immune parameters, Or on several others, what are these bhasmas, They are the nanoparticles, How their physical or chemical property change when you process them in a traditional manner, So there is a lot of work which is happening in Ayurvedic biology. Ayush genomics is one of the outcome of that which you kindly mentioned. Let me come to the next point, I want to tell you that because of this, again, the Western influence, and I'm not really differentiating Western and Eastern from that perspective, because I believe that modernity, what is modernity after all? Modernity, I would say that it's a continuing tradition. At one point of time, Greek traditional medicine was converted into modern medicine because they went through with modern science. But Ayurveda was deliberately kept aside from all these developments. So we missed our brush with Industrial Revolution, We were kept out. And not only that, we were suppressed. What you mentioned was very true. We were suppressed in our own country. Our knowledge was suppressed. Our knowledge was vitiated, to some extent diluted. And therefore, today also, you mentioned about Wikipedia. I feel so pained, Even today, Wikipedia mentions Ayurveda as a pseudoscience. And I tried my best to remove it. But the influence of those liberals in Wikipedia is so much, and they are in large number, that next day, whatever I have changed is completely erased. And because these social media work on number games, we are in minority there. So we have to really do something to increase our presence in social media so that the right messages and right information can be given to the world. One of the things which we unknowingly adopted is we started equating health with medicine. This is typically influence of Western. We started thinking that we can get health only by taking medicine. But health is something different, swasthya. But WHO, you mentioned that WHO definition of health we have challenged in our own book, and we are saying that WHO definition of health is not complete because it is connected with something which is measurable, and that measurable entity is disease. And therefore your entire focus in the definition has come on disease. But health, swasthya, prasanna atmendriya mana, means the kind of simple but so deep definition of Ayurveda which gives, I have not seen such a comprehensive definition of health as swasthya. But while talking about health and medicine, we also are ignoring what is happening today. We get influenced by pep talks about evidence-based medicine. But what do you mean by evidence? Now my friend is sitting here, Professor Mohanan, and Professor Mohanan is sitting here very calmly, he is not that quiet person, so don't underestimate him by looking at him. He has taught in top of the top universities in the world, where you would dream to go and learn, be it MIT, Stanford, Texas, and Singapore. In India, when ICER was established, he was invited to be professor at ICER in Pune. He and his wife, Tara, who comes from again a Warrior family, and I think Tara has influenced more and more to become more prone to Ayurveda. But the kind of work, which is happening here, what is evidence? Have we asked this question? Is modern medicine what they call it as evidence-based? It is really evidence-based? I am raising this question. This week's JAMA, Journal of Association, Medical Association, American Medical Association, one of the top journal. There is an article, Dr. Warrier, in JAMA, and they have clearly stated there that there is no evidence for use of vitamins as preventives in diseases. No role, no evidence. So what kind of evidence-based medicine practice doctors are doing when they are prescribing medicine? So this also is something which we need to really boldly talk about. And on one side, when we talk about evidence-based medicine, we are ignoring practice-based evidence, And that's what Dr. Tanuja probably will touch upon. And we are stressing it very much, that practice-based evidence is equally important. And I was talking to Dr. Warrier that one of the projects which we want to undertake now is select hospitals like AVS Hospital, 10 hospitals like AVS Hospital, which are classical Ayurvedic hospital, and 10 hospitals, top-level allopathic hospitals, and take diseases, say arthritis, and see what has happened during last 10 years for arthritis patients, actually in terms of outcomes. What is happening, what allopathy is giving them, and what Ayurveda is giving them. Let's do head-to-head comparison. And our hypothesis is Ayurveda will, in basis of evidence, will be much ahead, because arthritis-like conditions are much better handled, and there is sufficient evidence. Even if you go to AVS, you will find that kind of evidence that exists. And in modern hospitals, if arthritis patients go, what they will do? They will give steroids, they will give NSAIDs, they will give painkillers, and at the most, the deformities come, they will give surgical interventions, But the disease will keep on progressing. But there is evidence now, these kinds of progressive diseases, the progress can be slowed down or even stagnated, if not reversed. So this kind of a evidence-based medicine fantasy, I am follower of evidence-based medicine. But the way in which we are practicing evidence-based medicine is not evidence-based. That's what the point is. Next point I want to mention is we are ignoring what is happening globally in India, and especially I'm talking about the elite community of India. And I would like to quote one of my friend. I will not take his name, but he is one of the very renowned Indologists. And he made this statement. He is a white American, traveled all over the world. He said, I have seen all the cultures, I have interacted with many countries and many people, but India is the only country I have seen where elite educated, that's what he used the term, elite educated, take pride in ridiculing their own culture. And when I reflected in my mind about that statement, it was so true, it was so true. So this, and therefore we are ignoring what is happening globally. Globally today, scientific community as well as pharmaceutical community also is striving hard to find solutions. And let me tell you, there are no solutions even in modern medicine for several diseases. There are very good quick fixes. Let me accept that. There are very good quick fixes. So if you have pain, immediately painkillers are there. If you have inflammation, immediately anti-inflammatory agents are there. If you have elevated blood glucose, there are agents to lower it down. But the root cause of that, and the power of mind, we have inherent power to heal ourselves. And in the process of modern so-called allopathic medicine, we have forgotten that power of self-healing. And that comes through Ayurveda and yoga also. So yoga comes in picture, and the practice here in India was all integrated right from the beginning. Now we have started talking about integrative, but earlier everything was integrated, And just to give you one example before I close, again I will take example of JAMA. Why I am taking example of JAMA? Because all of us think that America is a big country, great country, rich country, which they are. But that doesn't mean what they do, everything is right. Their health system is in shambles. And Mahadevan is sitting here who knows America very closely, very well, So, JAMA again, 10 reasons for death. 10 top reasons for death they have published for last 3 years. Except COVID period. Now COVID, because of COVID, number 3 was Corona, But otherwise, cardiovascular disease, number 1 killer, cancer, diabetes, asthma, all these are non-communicable diseases for which we really have no definitive answers, And in Ayurveda, the Ayurveda doesn't talk about chemotherapy, Ayurveda doesn't consider cancer cells about enemies, Ayurveda talks about really creating an environment where healthy cells will grow more and cancer cells automatically will get invaded, So these are the different epistemologies. So when we are talking about evidence and evidence-based research, these epistemological differences, unless we take into consideration, we cannot progress further, If we blindly follow the modern methodology for studying Ayurveda, many times we can fail. And I have failed in my life while doing that. So I have learned my own way. I can tell you that blind. So we'll have to create our own methodology. And that's what Dr. Rama Jayasundar has done. And she will speak about it more. Being a physicist and MRI scientist, she has used MRI, to understand basic principles of Ayurveda. One of the fascinating work which she has done. So at the end, I will just tell you that centers like Arya-Vaidyashala Kottakkal are very, very precious. I am so happy that Minister of Ayush already has recognized you as Center of Excellence. And the team of all volunteers, I would say, because all of you are so much in demand. If you go out, you will mint a couple of times more than what you will earn here. But you are missionaries here. You are doing this mission which Vaidyaratnam Warrior has started, and the whole Warrior family is dedicated for this. So this precious thing needs to be really expanded, and this example, this is inspirational example, and I hope that more and more such examples come in. Today there are some very few peaks of excellence. We need to really combine them, create a network of them, and build a very strong system wherein we will be able to revitalize our own traditional systems, not just Ayurveda. But I was so happy, I went into the exhibition, and look at the vision of Dr. Warrior at that time. So many 100 years ago, he thought of communal harmony. Look at the gate. I was so amazed with that kind of a vision. And the way in which he is treating Ayurveda not in isolation, but also Kathakali, your art, music, everything is combined. Art, and unless you have this kind of a holistic experience, you will not be complete. And the students are sitting here. I must tell you that you are very lucky that you are in this city, blessed city of Kottakkal. Actually, Kottakkal is a global capital of Ayurveda, I would say. So you are actually studying in global capital of Ayurveda in one of the best institutions, which is blessed by Dr. Warrier. I wish you all the best, and I'm sure this experiment, which was started more than 100 years ago at Kottakkal, will only grow and become stronger and keep on inspiring many more to follow them. Thank you. Namaskar. Jai Hind, Jai Bharat.
Thank you for your kind and encouraging words, sir. Expressing our gratitude, we request Dr. Bhushan Patwardhan, sir, to receive a memento from our Managing Trustee, Dr. P.M. Varier, sir. Sirs, please. We may now move on to the book release session. Presently, we are releasing Ayurveda, The Expanding Frontiers, the academic volume prepared in connection with 150th birth anniversary souvenir of our founder, Vaidyaratnam P.S. Varier. It is an anthology of invited articles written by experts from different fields of Ayurveda. Recognizing the paradigm shifts happening in the domain of Ayurveda in recent times, AVS thought it appropriate to bring out this volume in the form of a compilation of diverse views on the status of these shifts and their implications. These essays look at the current trends of development in important aspects of Ayurveda from an academic perspective. They collectively present an interim perspective on the expanding frontiers of Ayurveda knowledge base. Responding to the request of Ayurvedishala, 43 authors have contributed to this volume, including a few from abroad. These authors include some of the leading experts of Ayurveda and allied sciences. And the volume is edited and formatted by Dr. T.S. Murali for AVS. Dr. Bhushan Patwardhan sir has released the first copy of the souvenir by handing it over to Dr. Vijay Kumar sir, Professor, Department of Cardiology, Amrita Institute of Medical Sciences, Kochi.
Thank you, sirs. Now we may move on to the release of Dr. P K Warrier commemorative volume of Ayurvedic Journal, a special issue with the main theme Tridosha Theory. Ayurvedic Research Journal of Ayurvedishala, initiated by Dr. P K Warrier sir, was actually a realization of his vision on dissemination of validated knowledge among the scientific fraternity. Ayurvedic, with 35 years of uninterrupted publication, has produced nearly 1,000 enriching articles. We are dedicating the special volume as a tribute to Dr. P K Warrier sir. We request Dr. Tanuja Nesri, Director, All India Institute of Ayurveda, Delhi, to release the journal by handing over a copy to Dr. Rema Jayasundar, Head, Department of NMR, All India Institute of Medical Sciences, New Delhi. Thank you, ma'ams. For the information of the audience, the copies of the released works as well as a few other publications of Ayurvedishala are available in the counter set at the entrance of this venue.
Now, we are about to start the technical session. Dr. C.V. Jaydevan sir, Principal VPSV Ayurveda College, Kottakkal, would moderate the session. Dr. C.V. Jaydevan sir has 30 years of teaching experience at VPSV Ayurveda College, Kottakkal. Sir's area of specialty is Manasa Roga. Sir has been playing key roles in various academic and research endeavors happening in the field of Ayurveda. Dr. Jaydevan sir also serves as a guide to Ayurveda PhD scholars at Kerala University of Health Sciences. Sir, we request you to start the session with opening remarks.
എല്ലാവർക്കും നമസ്കാരം. കുട്ടിമാൻ്റെ ഓർമ്മകൾക്ക് മുൻപിൽ ആദരാഞ്ജലികൾ അർപ്പിക്കുന്നു. I think we will straight away start with the scientific session. We have 3 presentations today. The first one by Vijay Kumar sir. It is already mentioned that he was graduated in Ayurveda from our college. Then he learned allopathic system and now he is a professor in Amrita Institute. So he is going to talk about atherosclerosis and coronary artery disease, the present status. It's a very common clinical condition. The Ayurvedic doctors also deal with such cases. Sometimes it is an emergency situation, the myocardial infarction. So we are going to hear about the atherosclerosis and coronary heart disease, the present status from Dr. Vijay Kumar. I was just asking him, are you going to say anything, the Ayurvedic aspects? He said, no, his presentation will be totally from the modern medicine side. The second presentation will be by Dr. Tanuja Nesari. She is going to talk about the lessons learned from COVID pandemic. Dr. Tanuja Nesari is heading the All India Institute of Ayurveda, New Delhi now. At the time of pandemic, the Ayush Ministry was really leading from the front. All the advisories and all the directions from the ministry was in coordination with the All India Institute. I can say that Tanuja Madam was really leading from the front. I know personally, I was involved in some of the research activities. She has done some commendable job for the ministry. And in the field of Ayurveda, it is very popular that all the medications, all the guidelines, everything, the central government was the first to release such directions. It was none other than Dr. Tanuja Madam who was working behind it. So she will be talking about the lessons learned from COVID pandemic. In the initial stages, I had listened some of her presentations. At that time, this data was not available because only was some experience she shared in the previous seminars. But I think this time she has enough data. I think that is very important. More or less it is connected with the third presentation also. Because the third presentation is by Dr. Emma Jayasundar. The topic is Research Vision for Ayurveda. I think the subject is already been introduced by G.C. Pillai sir and also Patwardhan sir. Because research is always a big question. Everyone speak about research. We need research. Then there is a question, what is Ayurvedic research? And also there is a fundamental question that should we have a separate Ayurvedic research? Because there is an opinion that research is always research. There is nothing like Ayurveda or modern. Because it's basically a modern approach. When you hear about research, people are afraid. Because we think only about clinical research. Because there are different types of research methods. But generally people think only about clinical research and various protocols, methodologies and so on. We can easily undertake some literary research. We can take some cross-sectional studies. But nobody is talking about that. When you say research, it is always clinical research. So it's also a great question, madam, that whether we should have a separate research methodology for Ayurveda. Maybe she is going to talk about that. Anyway, there are 3 different topics. all the topics are entirely different, but it's a very interesting topic. I think we'll directly start with the presentations. First Dr. Vijay Kumar sir, then Tanuja madam and Rama Jayasundar madam. It's 20 minutes each. It's a brief presentation. It's not easy to deal very big subjects in 20 minutes, we know. But anyway, with this introduction, once again, let me offer all my salutations to the memories of Kuttiman. Thank you very much.
Thank you, sir. So let's start the presentation session with a talk by Dr. M. Vijay Kumar sir. Sir would speak to us on the topic Atherosclerosis and Coronary Artery Diseases, present status. Sir is a clinical professor of Center for Aortic Diseases and Marfan Syndrome, Adult Cardiology and Heart Transplantation. Sir is especially interested in research in atherosclerosis and devices, dietary oil and coronary artery diseases, nano-surface engineering of bare metallic coronary stents for instant restenosis. Sir has also been a part of many significant clinical trials like perioperative ischemic evaluation study. Sir, please.
സദസ്സിലും വേദിയിലും ഇരിക്കുന്ന മാന്യ വ്യക്തികളെ, സഹോദരി സഹോദരന്മാരെ, നിങ്ങൾക്ക് എൻ്റെ വിനീതമായ കൂപ്പുകൈ. ആയുർവേദ രംഗത്തെ അതിപ്രഗത്ഭ വിഷഗ്വരനും ദീർഘവീക്ഷണവും വിദ്യാഭ്യാസ വിചക്ഷണവുമായ ശ്രീ പി കെ വാര്യയുടെ അനുസ്മരണ ദിനത്തിൽ ഇവിടെ വന്നു ചേരാനും ഇതിൽ പങ്കെടുക്കാനും സാധിച്ചതിൽ ഞാൻ അതീവ സന്തുഷ്ടനാണ്. ഇതിനായി എന്നെ ഇങ്ങോട്ട് ക്ഷണിച്ച ഇതിൻ്റെ സംഘാടകർക്ക് ഡോക്ടർ രമേശ്, ഡോക്ടർ പി എം വാര്യർ, എല്ലാവരോടും ഞാൻ എൻ്റെ നന്ദി രേഖപ്പെടുത്തിക്കൊള്ളുന്നു. ഈ വരുന്ന ഒരു 20 മിനിറ്റ് സമയത്ത് ഞാൻ വളരെ പ്രധാനപ്പെട്ട, നമ്മുടെ ഇടയിലുള്ള ഒരു പ്രധാനപ്പെട്ട അസുഖമായ അതെറോസ്ക്ലെറോട്ടിക് കൊറോണറി ഡിസീസ് എന്നൊരു അസുഖത്തെപ്പറ്റി വളരെ ബ്രീഫായിട്ട് നമുക്ക് ഈ കഴിഞ്ഞ കുറേ വർഷങ്ങളിൽ നമ്മുടെ എവിടെ എന്തൊക്കെ അഡ്വാൻസ്മെൻറ്റ് നടത്തി, എന്തൊക്കെയാണ് നമുക്കതിൻ്റെ ഉള്ള ഗുണങ്ങളുണ്ടായെന്ന് ഒന്ന് പറയാൻ ഉദ്ദേശിക്കുകയാണ്. So first of all, why I choose this topic, because this is the one disease which is commonly treated by everyone, irrespective of the domain they are practicing, either Ayurvedic, allopathic, Siddha. You may get at least one patient per day to treat this sort of patients. So I thought this is maybe a right topic to talk today. So let me see how the disease progressed over the world and what is the scenario as of now. See, if you see the real statistics, we compare 1990 to 2020, there is at least twofold increase in the number of diseases which has happened. It's around 530 million cardiovascular diseases in the world now. And as far as the death is concerned, from the 17 million now we are reaching out to 20 million. So in spite of whatever advancement we made in the last 4 or decades, the number of diseases and the number of deaths are still increasing. It's not decreasing. That's an alarming situation. You can see that this is the percentage change of the disease in the world. You can see that no, it's not working there. Our country, India, you can see that more of the places are either red or brick. That means the change of number of cases are much higher in this part of the world. And also, if you see the number of cardiovascular death which is happening in the world, we are the second highest Probably you can say that we have that much population. But I would say that 1/6 of the Indian populations are living in the villages. They're not abusing whatever the things which has been used by other people. But still, we have such a high disease and such a high death rate of cardiovascular disease. You can see this here. You can see that the major cause of death is ischemic heart disease, followed by intracerebral hemorrhage, then stroke, then hypertensive heart disease. This is the situation right now in the world. And also, if you look at the factors which is contributing to this disease, there is not much change over last 20 years, but the tobacco smoking has slightly come down compared to the obesity part. And this is one thing we are calculating to see actually how a disease makes problem in a community or in a society. This is what called the number of years lost in disease and disability. And you can see that this is also much higher in some part of India. So that means even though our people are living in the country, most of the people are farmers, they are utilizing more vegetarian food, but the disease is still beyond our control. And as I said, now coming to the Indian scenario, out of 18 or 19 million death, 1/5 of this death happen in our country. That is too high. So out of that, you can see that out of 1,335,000 deaths are happening in India. And how we are different from other countries? Of course, because the CVD in our society is very rapidly progressive, which happened at least 1 decade earlier compared to the other ethnic groups in the world. And also we can see that the number of hospitalization, the death from the cardiovascular disease is much high compared with the other people living in other part of the world. So what about in our state? We claim that we are the most educated, our health system is so superior, but still what you can see that compared to 1990, the incidence of cardiovascular diseases increased 3 times in Kerala. And one important thing, there is no difference between the rural and urban incidence of cardiovascular disease in Kerala. Now briefly we look, what are the factors which contribute? We can never say that this is the one which is likely to produce heart disease, just like pneumococcal pneumonia, pneumococcal bacteria produces pneumococcus pneumonia. You cannot say that cardiovascular disease is caused by such and such things. But there are a lot of factors which contribute for the development of cardiovascular disease. So certain things which we can modify, certain things we cannot. For example, the diabetes, hypertension, obesity, smoking, sedentary work, all these things can be modified. But looking at the other side, the age, because once we start growing old, the incidence of cardiac diseases are becoming more and more, that you cannot change. And also the gender. As you see, 100 cases of cardiovascular disease, especially the coronary disease, 70 or 65% may be the male population and only 25 to 30 are females. So this also you cannot change. And the second most important, the genetic factor. Suppose your father, your grandfather, your uncle or mother, somebody is having a cardiovascular disease, you are likely to get it more compared to the other people who doesn't have a family history of coronary disease. And now, after all this, as I said, now the people started realizing that this is nothing, but there are few other things which can contribute to the development of coronary disease. Number one, as you said, now the most important focus is on air pollution, then chronic inflammation. This is very important thing. Even the long-standing inflammation over the gum, that's called the gum disease, which can also lead to coronary disease in the future. So any chronic inflammation like rheumatoid arthritis, SLE, whatever it's a reason for coronary disease. And also now recently we noticed that the involvement of the liver with the fatty infiltration can still cause cardiovascular issues in future. So these are the few causes which we realized recently that can lead to cardiovascular disease. On this side you can see 3 important, stress, sleep and social. This is very important. Now recently in 2020 there was a paper published from US. They studied around 2 lakhs people and followed up for 20 years. And they found out what is the major reason for the death in that society. And they found that it's not treating hypertension, it's not treating diabetes, it's not stop smoking. The most important thing, how you get integrated to the society, how you are an individual in the society. If you can go to a shop, talk to the shopkeeper, if you can go to the auto rickshaw driver, speak to him, be a part of the society. That is the one important thing which keeps the person alive for more years. Not treating hypertension, not diabetic, not smoking. So these are the social factors are so important in developing progression and death from cardiovascular disease. As we know stress maybe 50 years back when William Harvey found that there are some things happening in the heart when there is stress. But now we know that all mechanism how the stress is going to produce heart disease. It's just nothing like that. It produces the stimulation of the sympathetic as well as the parasympathetic system is the balance of both, which produces vasoconstriction, vasospasm, and all platelet aggregation. Lot many things can happen. So stress is very important. So apart from that, what we recently know is about the cells which leads to the accumulation of fat or whatever in one of the major artery in the body. Initially we know it is the macrophage which is coming from the bloodstream into the intima, inviting the other cells, producing a foam cell, producing a bulge in the artery which is rupturing, producing thrombosis. But recently we know that there are lot many other cells are participating in this process. That is the one recent development. And the second thing, during aging, after the age of 50 or 60, the incidence of cardiovascular disease is increasing so much. So what happens during that age? When we are aging, there are certain things happening in the body. That's called the clonal hematopoiesis and the senescent cell producing inflammatory markers. So these are the recent development. And of late, what we know, our intestine contain millions of bacteria. This produces some metabolites in the body. So how this is related to the heart disease? I'll come to that later on. So these are the few new things which we are interested to see or to treat the patient with cardiovascular disease. So what happens in aging? As I said, during aging, there will be inflammatory state. There's an inflammatory stage. So that leads to the secretion of lot of what you call chemotactic factors for like interleukin beta, alpha, so many things, which will damage or which will invite more other cells into the subintimal space that will trigger the formation of coronary disease. And also, we know there is proliferation of macrophages and monocytes, which again interact with other type of cells. Previously, we don't know whether other types of cells, I mean the T and B lymphocytes are participating in the development of atherosclerosis. And as I want to tell that the genetics is very important to understand biology. So now we know the genetic basis of many disease. And some people believe that there is a genetic predisposition for all disease. But if you see the atherosclerotic coronary disease, about 40% have a genetic basis. This is not easy to understand, but there are large, databases. Not in India, but in other countries, like in Japan, in US or UK. And this is the data from the genetic basis. But usually, if you see it very closely, what happens now, our traditional risk factors, like diabetes, hypertension, hyperlipidemia, all these things are linked with the genes. And that we know the relation, why the atherosclerosis develop in certain families or in certain societies. But most important thing, understanding the genetics, is a therapeutic development. For example, they found that a family in France with some enzyme deficiency, that's called PCSK9. When the PCSK9 is deficient, what happens? The cholesterol levels are very low. And this family, if they traced 4 or 5 generations, and there were no single incidents of coronary heart disease. So this PCSK9 can be used as a therapeutic tool to treat the patient or those who are developing atherosclerosis. So genetics is very important considering the forward, looking forward for the treatment for coronary artery disease, not just understanding the development of coronary artery disease. So briefly I'll say what happens, how the atherosclerosis develop. It's nothing, the inner rail of the artery, which is the endothelium. The moment it gets damaged due to anything, hypertension, diabetes, smoking, stress or whatever, the lipoproteins which are flowing through the vessels leak into the space called intima, just below the endothelium. Once they are in the intima, it gets oxidized. The moment it gets oxidized, what happens? The endothelial cells over that develop some receptors which invite the further cells from the bloodstream. For example, the monocyte, which slowly leap into the intimal space where it becomes macrophages. It will change into a different type of cell. This will take more and more cholesterol, or what you call the esterified triglycerides and LDL cholesterol. Then it becomes a foam cell. It's called a foam cell. Once this accumulation is becoming more and more, the lower layer, what we call this one actually, the lower one, this layer, there are some cells called smooth muscle cells. Initially we thought these smooth muscle cells are inert, but it's not. This will actively come into the intimal space, produce calcium producing cells, change the scenario there, and they invite more calcium that produce calcified lesion. So once they have reached it as a particular stage, this will start producing a protrusion into the vessel wall. Ultimately, what is called the part? It's called the cap, which rupture. That moment, what happened? The platelets which is flowing through the vessel wall getting accumulated. That produces a thrombus, which leads into myocardial infarction, unstable angina, stroke, peripheral vascular disease, whatever. So this is the way the disease progresses. Initially, it was a small plaque which increases, then the cap rupture, the platelets and other cells aggregate, completely block the artery. At this moment, they can develop stroke, peripheral vascular disease, kidney failure, or heart attack. So this is the disease process happening in this. So how clinically how it looks like when you do an angiogram, you see that the lumen of the artery is narrowed. It can happen in any part of this vasculature, but it happens in some particular area. What happened? The large area of myocardium, what do we call under jeopardy? That means that area is not getting enough blood to perform the contractile or the relaxation function. This you can see. This is one of the presentation. This is the extreme catastrophe of this disease, the patient coming with an acute myocardial infarction. This is the right coronary artery. You can see the first panel, the artery is completely occluded, and you can see a small wire. That is an angioplasty procedure, and the artery is started flowing again. So these are the different ways this disease can present. And it's not only happens in the heart, but it can happen in the brain too. This one shows that this is the carotid artery, which has got a significant stenosis here. In the coronary artery, here you can see a significant stenosis. This person can have a stroke at any point of time because the thrombus which is released from this artery goes into one of the hemisphere, can produce an hemiplegia. And here you can see the leg vessel, which is completely occluded from the superficial artery to the popliteal artery, large. And here you can see the renal artery. So none of the organs are spared from atherosclerosis. Any part can be affected with that. Then coming, how we can identify this. But as of now, there is no blood test. Just like going and checking the blood sugar, there is no blood test to understand there is atherosclerosis or coronary disease. But there are a lot of tests when an organ gets affected. For example, there is a myocardial infarction, we can estimate a lot of enzymes, troponin, CKMB, CK, myoglobin, lot of things can be. But to know whether a person is harboring this disease, there is no blood test as of now. But there are a few things, for example, for high sensitive CRP. These also just indicators. It's not means that high sensitive CRP is high, that means the patient is having coronary disease. It's not like that. Then we have a lot of modalities to detect the disease early. Like the most common thing which is utilized nowadays is CT scan. You just go have a few minutes under the CT machine. It tells you that there is any development of small calcific plaque in the coronary arteries. The moment the calcium is there, that means the coronary artery is likely to have an atherosclerotic plaque. Also, the Mdct coronary angiogram, that's a non-invasive way of understanding the disease. This usually utilized in those who are having high risk. Suppose there is a family history of heart disease. The person was smoking for many years. He's diabetic, hypertensive, highly stressed. And suppose he wants to know whether he's having a heart disease. We can ask him to go for a Mdct coronary angiogram. That doesn't mean a catheter putting into the heart. Then we can have echocardiogram. Echocardiogram also that shows the effect of the ischemia on the myocardium. Also the treadmill test, that also shows the ischemia in the myocardium. And nuclear perfusion scan, of course, that tell us which part of the myocardium is involved with the ischemia. And finally, if there is some evidence, if the patient is symptomatic, if needs, we can go for an angiogram. So this is the Mdct evaluation. We can see the coronary arteries calcification, and this is another test called intravascular ultrasound. I'll come to that later on. So this is a evaluation. This is called an intravascular ultrasound. What happens here? We can see the inner layer. This black one is the media, the inner one is the intima. You can see this is the calcium in the coronary artery. So when we are going for a angioplasty or bypass, or to assess the significance of the lesion, we can resort to this sort of investigation. But let me tell you that this is highly invasive. We have to put into the catheter, another tube into the heart. And also, now we utilize a text called OCT. This is called Optical Coherence Tomography. This exactly tell you what type of block you are dealing with, whether it's a calcium, whether it's a fibrous, whether it's a high cholesterol, or what is the extent of the disease. And also, here you can see some part, the stent struts are seen. This is done actually after an angioplasty, so we can see the stent in that particular OCT run. And also, at times what happens, there will be multiple lesions in a patient. One in the top, one in the middle, and one in the low. But we don't know which is actually producing the symptom of the patient. To understand that, what we can do is a test called FFR. It's called a fractional flow reserve. It's nothing. It assesses the pressure of the blood proximal to the block and distal to the block. If the ratio is less than 8, that means the block is significant. The patient needs to go for either angioplasty or bypass. If it is less than 80, we treat them medically. We will never put in a stent. We will never do an angioplasty for them. So this is the way we understand the functional significance of the coronary stenosis. But this is very important because of the large clinical trial. The trial name is ischemia, which is done in the West, shown that if a patient is stable with coronary disease and if the lesion is less than 75 or 80%, these people will do excellent with the medical treatment. No need of an angioplasty or bypass surgery. So that it means that the moment you see a block, it's not an angioplasty, it's not a bypass surgery, it can be well treated with the medical treatment, provided the significance of that block is less. And this, as we discussed, this is called a nuclear perfusion scan. This is nothing. We'll inject either technetium or MIB into the myocardium and ask the patient to exercise. So during exercise, if there is an area where this perfusion is not happening, it means that particular artery is the culprit. The patient can have block in other arteries, but that doesn't require treatment. We treat only the artery which is supplying only this specific part of the myocardium. Now, I'll come to the treatment part. The medical, it's a very, very important. Recently, the people are coming more and more emphasizing that the medical treatment is as good as angioplasty or bypass surgery, or the patient can completely carry on with the medical treatment for a long time. So medical treatment is very, very important. And at certain time, suppose the patient is getting recurrent angina, is not able to move. not able to carry out its regular activities, not able to use the toilet, driving, going to the bank. All these things are there. If the patient is really symptomatic, we need to go for an angioplasty. Also, at times we call some anatomical reasons. For example, the patient has got a significant stenosis in the left main artery. If there is a block in the left main artery more than 50 or 60%, that is an anatomical reason to go for with the angioplasty or bypass surgery. That means that if something happens to that part of the artery, about 60 to 70% of the myocardium is going to be ischemic. So this is an angioplasty. When coming to the angioplasty, there are a lot of development over the years. Let's see, the stents were available in late 1980, 91. Then there are a lot of modification. The first we used just cobalt chromium or the medical grade steel for this. But later on, we started using what you call the drug-eluting stent. The stent is coated with some medicines. This medicine prevent the whatever pathology we discussed. The smooth muscle migration, the proliferation of the cells, the neo-intimal proliferation, all these things can be. This is actually an anti-cancerous drug, which is coated over the stent. It's called drug-eluting stent. This drug-eluting stent has gone further evolution with in the means the way we are coating the stent with the drug, which needs a polymer. The polymer will remain in the vessel for the lifetime. So that itself produces inflammation in later life. So what happened? The polymer has become biodegradable and people started using polymerless stent. And of late we have stents which disappear after some time. It is produced from APLA or things like that. After 1 or 2 years, the stent completely disappear from the coronary vasculature. This is also important because when there is a metallic scaffold in the stent, the normal movement of the artery. So what happens the moment the blood starts pumping from the ventricle, this pulse wave starts going from the root of aorta into every small vasculature in the body. When there is a metallic scaffold inside the vessel, what happens? This pulse wave may not travel properly. So always better to have a stent which disappear after a few months or years. Then what is the other advancement we made in the angioplasty area? See here what happens if the lesion is very much calcific. Sometimes you see the block is entirely calcified. Just under fluoroscopy you can see the entire vasculature even without any contrast. So these vessels are highly calcified. So to move that calcium, we need to cut the calcium in the vessel. So we can use what is a cutting balloon. This is actually the blades which is incorporated over the balloon. So the moment you start inflating these cuts, it's make specific cuts into the endothelium. So that allow for us to dilate the artery better way to put the stent again. So there are two types. You can see one is a balloon, another is a score balloon. And this is a very common technique used in the clinics. This is called rotablation. What happens? The artery is so much thickened. Nothing is going through that. No balloon, nothing. So this is a platinum burr. It rotates around 2 lakhs per minute, the very high RPM. So this pulverizes the calcium inside the artery, make the artery little more smoother, then we can put in a higher balloon or stent. This is called rotablation. And this is nothing but here what happens, whatever the deposit happened is only in the one part of the artery. So this can be actually cut and taken out. This is called atherectomy. This is actually a blade-like thing we can put into the artery, cut that part and remove it. It is called atherectomy. And also, sometimes even with the rotablation, you may not be able to dilate the artery into 3 or 3.5 millimeter. Then what we use is called an EVL. This is called the Endovascular Lithotripsy. Just what we treat like treating for the renal stones. This balloon inside the artery produces ultrasonic waves. It passes through the calcium, disintegrates the calcium. Later on, we can make the artery bigger and put in a bigger stent. This is called endovascular lithotripsy. And this is nothing, the lasers are used in every aspect in the physics or everywhere because a laser is utilized for everything. So here also we can remove the calcium by using a laser. And there are times you may not address a person's block with what you call the percutaneous transluminal coronary angioplasty, PTCA. That means catheter-based treatment. Certain people require bypass surgery. See, this is one of the case, this patient, the 100% benefit with bypass surgery. Because if you see carefully, here the lesion is in the left main coronary artery. The lesion is in the what you call, this is an L, because my torch is not working here. This is what we call the LMCA. You can see the artery and the top, the first section has got a significant stenosis. That is better visualized in the second view here. So this sort of patient definitely requires a bypass surgery. Angioplasty is not an option because of the heavily calcified vessel involved under the left main. So what are the advancement of bypass surgery compared to 10 or 20 years back now? Now we can use off-pump surgery where the heart is not connected to the heart-lung machine. The heart is still going on beating, the surgeon can repair the block. This is called off-pump surgery. And also we can use micro CABG. Compared to the whole opening of the chest up to the abdomen, you can put in a small incision and can do the surgery. That is called mini thoracotomy and surgery. And also now it's very common to use the robots because the incision is too small. The surgeon can manipulate the arms of the robot very well, and again the patient can get discharged from the hospital second or third day. Now coming to the most important part of the treatment, why I kept the medical management later, because now even if the patient undergoes angioplasty or bypass surgery, the person needs to continue certain medicines. So what are these medicines? The most important medicine the person has to continue is what we call the antiplatelets, which prevent the aggregation of platelets inside the coronary artery. So we have different times according to the person's what you call the acute coronary syndrome status. We choose one of them. But the last one I mentioned is in injectable. When the patient is coming with an acute MI and the patient is unconscious, not able to take medicines, we can give that intravenously. Then these are the medicines which we are usually utilized in the clinical practice, which is antiplatelet, then cholesterol reducing drug, nitrates, beta blockers, so many things. But certain things needs to be mentioned specially. For example, the cholesterol lowering drugs. Because on the all evidences, either this is an animal or the human, whatever what we know as of now, is the main particle or the substance which gets accumulated in the coronary artery below the endothelium is cholesterol. So this needs to be addressed. So we have a lot of medicines. For example, the most common, you may all know about the statins. There are different types of statins, which actually prevent the synthesis of cholesterol by inhibiting the HMG-CoA reductase enzyme in the body, and lot other medications. But what is our interest now? There are some drugs which is invented maybe 5 or 6 years back. This is called PCSK9 inhibitors. When you inject this will inhibit this special enzyme called PCSK9 that will decrease the cholesterol LDL receptors on the hepatocytes. So what happens, the more and more cholesterol gets transported from the bloodstream into the into the liver. So what happens, the circulating cholesterol will be less. So this is one of the advancement made in the treatment of coronary disease called PCSK9 inhibitors. Now many centers in India as well as in Kerala, all over the world uses this particular injection when the patient is getting admitted with an acute MI or what we call acute coronary syndrome. Not somebody who is coming with a chest pain and investigating and found out there is some block. Those patients are not candidates for PCSK9 inhibitors. Only those coming with acute MI and those who have familial hypercholesterolemia. And there are still another drug which is FDA approved in last April. This is yet another PCSK9 inhibitor. This has to be taken only twice in a year. The other one which needs to be taken every 2 weeks. But this medicine needs to be taken only 2 times in a year. And still there are a lot of drugs in the pipeline. That's more important is one compound which can be given once, which can prevent the synthesis of cholesterol for a longer time, more than 8 or 9 years. In spite of all these things, there are a lot of other things we could not understand even now. Number one, how a different person is behaving in a different way with a stenosis. Because we have seen a person harboring a significant coronary disease 10, 15 years, coming back and getting an angiogram. Nothing happened. He's living happily, no issues. But yet another person with a 20 or 30% stenosis may come with an acute MI in the coming 1 or 2 years or months. We don't know what is the reason for that, what's the explanation for that. And also, it's not possible to identify some person who behave very badly after developing a heart attack. Some people with a trivial MI, we lose them in the hospital, either in the cath lab or in the ICU. We cannot predict. So, this is a very common disease, especially in our country and our state. Younger and younger people are getting affected. I have treated patients at the age of 25 with an acute MI, 20 years of acute MI, but it's more common in advancing age. So, let's see what we can do from Ayurvedic perspectives for it. Because I discussed the stages of development of the plaque only for that reason. Because it's a very gradual development. It's not happens overnight. So during this, whatever that incubation period, when the LDL cholesterol leap into the intima, developing the macrophages, whatever it knows, that's a long period. How to identify these people? If we can identify how we treat this patient with an Ayurvedic concept, whether it consistent with whatever we call an AMA period, but it's just the disease is just brooding inside, not yet manifested. That's one important thing. But later on, when it produced a significant stenosis in the one of the vessel, either in the brain or in the kidney or in the heart, then it actually produces what you call esrodhorodham, that completely or partially block the artery. Here, some treatment can be offered to remove or to open that blocked coronary artery. And third thing, the main important thing, as the disease occurs more in elderly, the aging process, as we discussed now, which produces a lot of inflammation, a lot of new cells, what we call the time-related apoptosis cells, which are pro-inflammatory. Whether this can be overcome by what you call the Rasayana Chikitsa. I think definitely the aging process, which contributing to the major number of cardiovascular patients. Suppose you see, 20 years back, our ICU were full with person with 50, 60 years coming with acute myocardial infarction. But recently, after 20 years, what you see, there are patients, either 70-year-old, 80-year-old coming with heart failure. So what happens, as the age advances, the disease is more, the complications are more, the patient end up in heart failure. So whether we can treat, whether we can reverse the senescence or the aging process in the body by Rasayana Chikitsa, by combating the atherosclerosis. Thank you for your person listening. I know that's a huge topic. This is just an overview. Thank you very much.
Thank you, sir, for the thought-provoking and enlightening session. We invite our CEO, Dr. G.C. Gopalapillai, sir, to felicitate Dr. Vijay Kumar, sir, with a memento. We may move on to the next talk by Dr. Tanuja Nesri ma'am. Madam would be speaking on the topic Lessons Learned from COVID Pandemic. She is currently serving as Director and Head, Division of Translational Research and Biostatistics at All India Institute of Ayurveda, New Delhi. Additionally, holding charges of Chief Executive Officer, National Medicinal Plan Board, and Chairperson of Health Sector, Sub-Skill Council on Ayush, Government of India. She also serves as a member of different organizations like ICMR and convener working group on the formulation of an integrative health system for Niti Aayog. She played a key role in the conversion of All India Institute of Ayurveda to a Kowitt healthcare center. Madam also works as a chief executive editor of AyuCare, an international journal of research on Ayurveda, and Ayush Journal of Integrative Oncology.
Maybe that's okay. I want to run this. Okay. Yeah. I can do this. Namaskar. Esteemed dignitaries on the dais, my friend and our mentor, Principal of Ayurveda College, Professor Jaydevan, co-panelist Vijay Kumar. At the outset, and all the esteemed dignitaries sitting off the dais, at the outset, I take this opportunity to pay my sincere tribute to the Doyen of Ayurveda, P K Warrier ji, and I am really blessed and feel honored to have been given me opportunity to present the experience sharing of lessons learned on his first test anniversary, and who really like we had learned that Gandhiji, Mahatma Gandhiji's life is my message, but we can say that this legendary personality in Ayurveda who has made Ayurveda and Kotakal as a synonym to Ayurveda, so we can say that he is the person whose life is the message for everyone to be followed. And we also pay tribute to the founder of Arya Vaidyashala group, Vaidyaratnam P.S. Varier ji, and my pranam to all the existing highly accomplished torchbearers of the Varier family, including present Managing Trustee P.S. Varier ji, P.M. Varier ji, Indira Balachandran, Ram Kumar ji, and many others, Deepa. And I can see that the Warriors, they had the commitment, sincerity, and all those qualities which are imbibed in the family, because what we received today's book, that was As Memory Unfolds by Vivek Vijayan, the grandson of the Warrior. It was really remarkable. So all my pranam and appreciation for the Warrior family. All the esteemed dignitaries of the dais, Professor Bhushan Patwardhan, who is our mentor, and whatever I am going to present, let me share here. Ministry had constituted a task force. Secretary Vaidya Rajesh Koteja, he had constituted a task force, and Bhushan Patwardhan ji was the chairing the task force along with VM Katoj. So what we have done, that is under your able dynamic guidance, sir. And there I can see various esteemed personalities, Mohananji, which I was introduced, and I can see the young torchbearers of the future, the scholars from the Kotakal Ayurveda College. I take this opportunity to present what we have learned as my friend, and I can see Dr. Unni Krishnan, my friend, Raj Gopalan, and many others, and Ramesh, because I think your pursuance, I was able to come here, and Deepa, who is really the protocol officer. So my pranam to everyone. And as Dr. Jaydevan mentioned, that we did many things during COVID. And what is All India Institute of Ayurveda? This is individualized by Ministry of Ayush as a aims for Ayurveda. It is the Translational Research Division, postgraduate teaching institution. But more than that, it is the tertiary care hospital, first NABH accredited hospital. And during COVID time, we had all possible things, COVID health center. It is not the quarantine center, it was COVID health center where we did dedicated holistic integrated management, COVID call center, testing center, vaccination center, public health initiatives, research programs, outreach programs, and many other. And it is a integrated, holistic, modern Ayurveda center where we do tertiary care, referral patients, challenging cases. As we have seen here, it is a center of excellence in cancer management. We also have the integrative oncology center, we have the integrative diabetes, rheumatology, and we have all specialty. We have 30 specialty units where we are dedicated to not only for the holistic well-being, but also for the treatment, holistic and integrated treatment. During COVID time, prevention is our strength. So we did preventive management, we did restorative care as a post-COVID management. But as we say that COVID ke saath bhi and COVID ke baad bhi. So what differently we did was the treatment, curative, therapeutic management of mild to moderate condition with holistic Ayurveda. And I mean to say that it is not only one medicine, but it was Panchakarma, diet, lifestyle, yoga, and recreation as it is. And as we see that the COVID-19 scenario today itself, many cases across the globe, and in India also the deaths are like one amongst first three we are also. But if we compare to the death rate in India, it is comparatively low as compared to any other even developing countries. Maybe we are living with our own traditional wisdom. Each and every family in India has used some or the other traditional medicines. That's what the research tells. So even though COVID, but we have to really say that COVID pandemic is not over. Now also it is not the fourth wave, but the COVID cases are increasing, and not a pandemic. It has become the endemic, and we have learned how to cope up with, but there is a still scope to find out the solution for the COVID and for the mitigation of this. Now when the task which is given to me, what lessons we learn from all these preventive treatment and therapeutic all activities what we did. So when the first case was declared and it was declared as a pandemic globally, then the entire world was standstill. The world was under the lockdown, and all the ministries and everyone was the lockdown. But Ministry of Ayush and All India Institute of Ayurveda, we just got this opportunity that most difficult time brings the best in you. That's the lesson. And that the blessing in disguise. So I must say that, and I can say it with confidence, that we have not stayed a single day. I did not stay a single day at home. We did not work from home. We arranged the curfew pass. We arranged all the vehicles, special vehicles, in collaboration with Delhi Police. But all of us are health care workers. We were on duty, and we started doing many public health initiatives. First was the advisories and many media outreach activities, campaign, because the education is the key, capacity building is the key. As the name itself was novel coronavirus. So the entire world was learning about the dynamics, about the mutation, about the presentation and the management. So we also thought that we also have to create awareness, because everyone was more anxious and more afraid about this situation. And then we understood that the anxiety was because of the ignorance. What will happen? Because everyone thought that once they get COVID, they will die. But it was not the situation like this. So we started doing the campaign, mass awareness, because the education is the key, awareness is the key. What are the stages, what is the preventions, that started doing the campaign. Initially, immediately we did the video competition, the recreational, just diluting. But when it was said to us that this is a tertiary care hospital and All India Institute of Ayurveda does this, then who will do the treatment? And that day, it was the turning point for us, because the treatment, treating the COVID was not allowed to Ayurveda, but we fought with the ministry, with the Delhi government, and we got the permission to treat. But before that, we collectively read and understood what was the classical wisdom for treating such type of pandemics, because COVID is not the first pandemic in India. Before that also, every 100 years there were many pandemics. Plague tha, there were many pandemics. So what is the history tells us? And we then got to know from Tanjavur and many others that those are the Ayurvedic Vaidyas and physicians, that they have contributed to lot for mitigation of pandemic. And through Janapadodvams Vyadhi, the one solution, very important solution, was Dhupana. That is a Havan, Yakya and Havan, because when you do the medicated fumigation, the viral load around the environment, because this Janapadodvams, that is, we have to not clear, cure, make this Swasthavars, but we have to live harmony with the nature. That was the second lesson we understood with the COVID. And it is, if we really have to treat, we really have to mitigate this pandemic, then first think about the environment. Live in harmony, because environmental pollution, Jala, Vayu, Kala, and these are the four factors which really are responsible, and Adharma are responsible for Janapadodvams. So what was in our hand, we started doing that. So All India Institute of Ayurveda, I must say, sir, that from that day till today, religiously we have appointed one Pandit, Yagya Karma, and every day we do Havan. Every day we do Havan and medicated, and those fumes are like medicated fumes, those are circulated. So that was one reason, I must say, that we all were safe. Not only because of this was the one major, but what differently we did, I just wanted to share with everyone. So the lesson we learned, that we really have to believe with our own wisdom. COVID was not only the first pandemic. There was hue and cry, but we learned from our history what our Vaidyas have done. We believed in that, we started doing that, and that really gave us the success. The lessons what we learned is that we can do better than anyone else can, and togetherness is the greatest strength. Why I mean saying that, when the entire world and everyone wanted to stay at home, and the home was the better place to avoid the infection, but all our healthcare workers and our doctors, they wanted to come to All India Institute of Ayurveda, because we created more safe place as a working environment. We were giving them the kadha, we were performing the yoga, we were doing the homa, and we all together were discussing about various aspects what we can do, and that really developed more confidence, courage, and more counseling each other, and that really made us work as a team, as a together we could do many things. It is not physically apart, but the socially connected. That was the lesson we learned, that we have to be socially connected, not apart. And various initiatives under the dynamic leadership of the Bhushan Patwardhan Secretary, and many have taken by Ministry of Ayush. But I must say that we were really on the forefront, because even ministry was also closed, lockdown, but we were all in the institution. So many things we could do we could sit together, we could do the advisories and also the consumers guideline and also the practitioners guideline. And these are the various activities you can see. The first worked on the advisories and all evidence based, whatever even the kadha ingredients, kasha ingredients also had some antimicrobial, the screen, and then expert under the task force, various guidelines were practitioners guideline, then the research was done. And because of the time constraint, I would not go into detail, but not only media outreach, but the largest campaign of awareness as Ayu Samvad, which covered 5 lakh lectures with My Health is My Responsibility, Swastha, how to remain Swastha and prevent the infection. That was also done by our team. And during COVID and every opportunity, because Ayurveda is classical, but we have to be contemporary, we should have been tradition that should be supported with the technology. So we did all many researches, and you can see from the medical colleges around Delhi, various training program for how to live, how to treat the COVID patients. And I must say that I would like to share with Bhushan sir also and Monan sir also that when we did the research and conceived the protocol, so what we really thought that if we practicing strength of Ayurveda is in non-communicable diseases, like metabolic diseases, what our friend Vijay Kumar also mentioned. So there is a great strength in Ayurveda for treatment of metabolic and stress disorders and degenerative disorders. But the strength for doing research, if we really want to demonstrate our efficacy, is communicable diseases, because we have definite parameters. And the duration, COVID really gave us the opportunity to demonstrate utility of Ayurveda, because the life cycle was only 14 days. So COVID positive, RT-PCR positive to negative, HRCT score, inflammatory markers, immune markers. So we could demonstrate within 7 to 14 days. And that's the beauty, that's the opportunity we exploited to treating the communicable diseases. It is the best research model Ayurveda can give. That is the lesson we learned, and we did that. So for that, what we wanted, we had lot of questions were raised by Delhi government health administrators also. You do not have the knowledge about wearing the PPE and DMIN. So we gave the training to our housekeeping, starting from housekeeping to paramedical to student to doctor, everyone got trained. Then the second question was, you do not have the enough infrastructure. We converted the hospital into communicable diseases, red zone, green zone, orange zone, green zone. So within few days, the entire structure was converted. So whatever the question was asked, the solution was provided, because we had a like-minded team and everyone wanted to work as a warrior, demonstrate, because that was the one argument which really touched our heart, that if tertiary care hospital of Ayurveda is doing only media outreach activity and not treatment, who else will demonstrate? So that really we took this as a challenge, and we converted our hospital as a COVID health center. And then there, not a single day the OPD, IPD, anything was closed. With emergency OPD, flu OPD, health center, testing, everything was established. R&D activities, practitioners guideline, Ayu Raksha kit, and the entire guidelines which were developed for COVID health center were focused on 3: preventing the entry of the virus, stopping the replication, and reducing the damage that occurs to our cell. And that also reflected into the advisory. And now when the advisory, the question was practicing, implementing advisory to each and every healthcare worker and every citizen came around. All the entire world and shops were closed. Even the lockdown was there. So what we thought, let us make a combo pack of Sanshamani Vati, Chavanprash, Kadha. So with IMPCL, our own manufacturing pharmaceuticals, we requested them, and the Ayu Raksha kit was there. And with Delhi police, दिल्ली पुलिस के साथ, पुलिस से जंग, कोरोना से जंग, दिल्ली पुलिस के संग, with the tagline 80,000 Delhi police personnel were given this Ayu Raksha kit. But the lessons what we learned here, because I know that many states, many organizations have distributed this COVID preventive medicine to millions and lakhs of the people. But what lesson we learn is not the public health initiative, but the lesson is that the documentation. So public health research mode was very important. So what we did it in the documentation. We developed the CISPRO software, and the data was captured about pre and post immune status, and the most important, when it was the remote, that was the incidence rate, because that was the objective marker, how many people they felt they were COVID positive. That incidence rate, quality of life as per WHO 36. So these were the simple objective markers what we really got, and that is not only public health but public health research for the Delhi police. And you can see these are our workers. They were not treating the patients in the hospital, but they were packaging the Ayu Raksha kit and loading and unloading. So these were the 4 combo packs. And as Jaidevanji mentioned, that I am here with the data. The data says that when the trend line of various metro cities was up, Delhi police trend line was down. The mortality for other metro cities was 3.2, but Delhi police mortality out of 2,000 only 22, 80,000 only 22, so it was 0.034. And even Delhi police, Delhi population trend line, Delhi police trend line was low. But when we discussed this with Public Health Foundation of India, so it was initial call to distribute, because we wanted to do, and रक्षकों की रक्षा करना हमारा फर्ज है. So that was we did. But they said that for publication you need to have more systematically designed study even in the public health research. So you need a good cohort. So what we did, we also conducted a study on 100 sample size pre and with the control, those who did not take and those who took that. What was the outcome? The outcome is very interesting. Those who really had this consumed Ayu Raksha kit for 60 days, they had COVID antibodies, because when you are infected, the antibodies, and we tested pre and antibodies. So 17% had the COVID antibodies, but those who did not take the Ayu Raksha kit, in them it was 56%. So that really provided the protection to this Delhi police. And now also it is not only the wave first, but Ayu Raksha 2, Ayu Raksha 3 and Ayu Raksha 4. Every wave we have this public health initiative, and we have captured the data. And now in the second wave, in the third wave, the more systematically designed study has been conducted. The same prophylaxis study with neem capsule was done with ESIC hospital, and with the sample size, that was the healthcare worker, because the prevention is the strength and we really have to utilize that. But as the world, what the tagline was, everyone was asking us the evidence. Bring the evidence for this traditional science. Until and unless you don't show it, we will not allow to use it in the COVID. So we really, even the vaccines were started with the empirical evidence, and the vaccines were also given and allowed by 55% of the efficacy. And this neem study also has given 55% relative effective. Neem is also the same, at the same time it was. Unfortunately, it did not got through, but it improved the quality of life, improved the work efficiency, and more important, in the obese person it really helped. And for them, not only atherosclerosis, but the weight loss and the other parameters it helped. That was the added observation, but it was also helpful in biochemical parameters. more important, what we could understand, that we have to care our own team, because when everyone was coming to All India Institute with high risk, so it was our moral responsibility to take care of each and every worker of our own self. So what we started, that Janapadodhom says that follow Dinacharya, follow Rutucharya, follow Dharma. So what we did, we started doing it in a samuhik, like total together. We started doing total group yoga, group recreation, and more importantly, we also gave this combo pack. Why only Delhi police? We gave to our own healthcare workers, and we did the same study with the immune markers, with the same quality of, with the outcome measures, and 413, it really effective, and even the increase in serum IgG level and the other parameters were also, this publication is in the process, and I'm sure this would definitely see the date of life. But we really felt that this holistic approach and integrated approach is the way. When we say that what is evidence? Evidence is just documenting, doing it meticulously, observing our own strength and documenting and demonstrating. Even everyone wants, the entire world wants the parameters. We showcase the same parameters, but that only communicable disease it is possible, sir. Non-communicable, there are many other parameters, and these were the various guidelines for the practitioners' guideline under the dynamic leadership. Our mentor, we were also, many of us, we took active part, and I'm sure our Arya Vaidyashala, Krishna Kumarji, Jaydevanji, and many, it was the consensual evidence. 6,000 physicians, they got together, and that was the practitioners' guideline. But what we did it, we implemented that also. From this practitioners' guideline, we stood for the care with compassion, because the tagline of care, COVID Health Center, we did it differently. Like any other COVID health centers, the hospitals, we saw that there were three main causes for the death. One was the drug itself, because no drug was proved as an anti-COVID, but tolacizumab and many higher antibiotics were given, and the patient died because of the adverse effects. Patient died because of want of food. Good food was not given because of the physical and social isolation. And third was the fear. Dar ke mare kai log gaye. So we reversed everything. We provided very healthy, good food, care with compassion. We created a model where we could speak, and all our workers, they used to go, and all our healthcare workers, that was the very good model for the leadership development, management module, we can say. All our youngsters, all team of 30, including housekeeping to paramedical staff to doctor, they stayed in the same floor where patients were admitted. They stayed in green zone, and the patients were into red zone. They used to have the PPE, and then again came back to green zone. But they also, it was made compulsory to have them doing the yoga, recreation. We provided them the good food. And I must say that there were many complaints from the postgraduate scholar, many complaints from the nursing staff, and the complaint was not giving them the opportunity to be in the COVID ward. They wanted to have this lifetime experience to be in the COVID ward, and the meticulous data is being maintained. And as in any other metro cities of the Delhi, healthcare workers, the infection was as high as 9%. And I'm really proud to say that none of our healthcare workers got infected in the COVID ward, because they were the safe environment and the stress-free. When you live together in the safe environment, I think that's the way of living together in this COVID. And you can see the person who is discharged, like RT-PCR positive to negative, he was being awarded for positive to negative early. So mean recovery time was reduced to 50% without any adverse effects and without progression of the disease. So these were some of the outcomes, and you can see the future is not only standalone one pathy, future is integration. Because even though holistic treatment was given, why the patients were saved? Why our doctors were saved? Because there was a co-location of intensivist. There was co-location of allopathy doctors, and we had the ventilators also, and each and every bed has a oxygen also. So if required, oxygen 4 liters per minute, everything, the SOPs were standardized. When we say that our military is very strong, then people remain peacefully. The same was, we had really created a very strong paraphernalia and our immunomodulators rasayan, so that everyone really felt safe. These are some of the pictures from our COVID health center, and when Vaidyaratnam you wanted the data, we have even each symptom also, what happened pre and post. So joint pain, all the symptoms, and the holistic treatment included not only kashaya but yoga, meditation, Ayurvedic diet, Ayurvedic medication also, more importantly recreation. Because patient they did not want to go. One patient's reaction, feedback was very important. He said that I have become positive to negative, from COVID positive to COVID negative. But I have become positive. I am going positive with positive attitude, because those 14 days they really celebrated, enjoyed like recreational transformation with them. And with more, now it is 700, but 655 patients, 94% patients, they received standalone holistic Ayurveda treatment, and 6% really required oxygen therapy or some allopathy medicine also, but none of them they really had to refer us. And in COVID too, when there was a more severe conditions, we started using ventilators also, and we did not have to refer any patient to any hospital. So what is evidence? As Bhushan Patwardhan sir mentioned that it is not evidence-based practices. What we demonstrated is a practice-based evidence. We practiced, we stick to our own fundamental principles of Samagra Chikitsa Paddhati, but the documentation was very meticulous. Because we had to communicate to Delhi government, so our HRCT, RT-PCR, immune parameters, inflammatory markers, we have D-dimers, and I can say that we can say that when CRP level, on the 7th day, if CRP is high, so what we had the target that do not increase the CRP level. Look at the D-dimer. With Ayurvedic medication only, CRP and D-dimer should be within the normal limit, and that we could really do it. And this was the spreadsheet, as sir also mentioned, the spreadsheet meant for Ayurvedic, our own study. And what is the integration of East and West, and holistic and integrated management is the future of Ayurveda. That's what the lesson we learned. And this deeply rooted science, if we really is still classical but yet contemporary, and if we use it with the technological advancements, it is still relevant to take care of public health, community health, communicable diseases, and also non-communicable diseases, as there is a myth that we should take. Lastly, the campaign, what we initiated is my health is my responsibility. Because the COVID, we saw that those people who did not get the COVID, they had very good lifestyle. If you see that the living legend in front of this dais in the PS, the first death anniversary of PM Warrior, we can say that the diet, lifestyle, immunomodulators, thought process, achara rasa, those who followed this as per the customized, as per the prakriti, they remain healthy. So we thought that let us create a campaign. स्वस्थ रहना कैसे, वो भी तो सिखाना चाहिए. People are not aware. बादाम अखरोट खाना और कुछ मल्टीविटामिन लेना, ये स्वस्थ नहीं रहना है. We have to follow Ayurvedic dinacharya, and that was the campaign Ayush Samvad 5 lakhs. My health, my responsibility, using the ministry's platform we initiated, and with very good response from every state, from every principal secretary, we got the response, and with the support of ministry we could do that effectively. Lastly, children are the precious wealth of the nation, we could understand, because we did not address anything for the children. काढ़ा children don't take, so we made it in the syrup form. काढ़े का सिरप बनाया, टैबलेट बनाई, उसमें मुनक का जितने भी बाल रसायन है वो सब उसमें डाले. That was validated, and that Bal Raksha kit was distributed before the vaccination was allowed. This was long back, and it was huge response. Even it was tweeted by Man Ki Baat PM also, Amitabh Bachchan also, that about the Bal Raksha, because it was very, very well ahead of having the vaccine developed for the children. We had developed the Bal Raksha kit for the children and distributed to millions of that. Now we really have to, and that was the one more important, I would stop here, because we should be really visionary and be opportunistic. What is the trend that we really have to understand? And sir, I want to say that yesterday I was looking after the matrimony. What are the youngsters, the young girls? The first choice, earlier it was IT guy, then the computer one, and they wanted engineer, the doctors, no one wanted the Ayurveda Vaidya. But now everyone's, more than 60% of the preference in the matrimonial is startup. So the startup is the buzzword, entrepreneurship, and we captured that, and we have the first incubation, even for the kadha, granules, tea, and we had the startup challenge for all those COVID deliveries, and that startup we received 167 challenges, and the first 5 were, first 2 were awarded by none other than Prime Minister of India at Global Investment Summit. And I have a proud feeling with the support of the ministry, with support of our mentors, and support of my strong team. Recently, we had an opportunity to have the visit of DG WHO, Tedros Adhanom, where we also had the Rangoli of our planet, our Earth. And when he visited all the facilities, he mentioned that this is close to the WHO's goal, and one model where GCTM is envisioned, maybe it can serve as a model, where as a baseline in India, where tradition meets to the technology. So these are various research projects, international, national research. I will not go to, because we have initiated many research studies, but most important study I would like to say here is study with Ashwagandha, because before the Ashwagandha person who has dedicated his lifetime to Patwardhanji, I must mention that we have studied with London School of Hygiene and All India Institute, where Ashwagandha in the long COVID we have initiated. And what is the beauty and what is the novelty of this study? This is the first herb which has cleared all the regulations of MHRA, and this will be practiced, given as a medicine, not as a supplement. So we have cleared all with the help of all the documents which were done preclinical, clinical study, because task force had identified 4 immunomodulators, Ashwagandha, Yashti Madhu, Guduchi and IU64. So this Ashwagandha with all the data and many publications we also did. Ministry did 150 studies as a CTRI. So many of them, 10% we have also done. And we have many publications also in IJR, in many other studies. So we started with practice-based evidence, but our journey now is to the evidence-based practices, because which is the only key for the global recognition. But when we designed the study, this study design is focused on our 2 principles of Ayurveda, and it is supported with the conventional outcome measure. Thank you one and all.
Madam, thank you so much for sharing the valuable information, ideas and the authentic data that you have on the topic with us. May I request our CEO, GC Gopalapillai sir, to do the honors of presenting a memento to Dr. Tanuja Nesri. Next, we have Dr. Rama Jayasundar. Madam would speak to us on research vision for Ayurveda. Dr. Rama Jayasundar holds a PhD in physics from Cambridge University, UK, and she has the rarity of holding a BMS degree in addition to it. She works as a faculty at All India Institute of Medical Sciences since 1993. Her area of specialization is biomedical nuclear magnetic resonance. She has a great deal of experience in both experimental and clinical MRI and spectroscopy. She is currently involved in scientific research in Ayurveda, its concepts, methods, pharmacology, clinical practices using NMR, MRI, and a number of analytical techniques. Madam, please.
And namaskarams to one and all here. My very deep pranams to the memory of the legendary Padma Bhushan, Padma Shri, Shri P K Warrier ji. I was not fortunate enough to have met him when he was living, but I feel very humbled and honored to have been invited to give a talk on his first death anniversary. I thank the management of Optical Ayurveda and Dr. P.M. Varier in particular for having invited me to share my thoughts on research vision for Ayurveda. Research, like many other, in any other discipline, is a very satisfying profession or activity, because it gives scope for contributing to the society, to the nation, and to the world at large. In addition, it also gives scope to one's creativity. So you all may think that it's only an artist who has to be creative. No, the researcher also has to be very creative to be able to do innovative and useful research. Now, this is all the more satisfying when you do research in, it's not getting connected. So this is all the more useful, satisfying when you do research in the field of medicine. Because in addition, you have the satisfaction of doing something that's going to help the patients. So research, so let me continue till they sort out the technical glitch. So research in any field is actually done to take that field forward. So whether it is physics or chemistry or mathematics or biochemistry or microbiology, research is, the goal of those research is generally to develop that particular field. And there could be fallouts of research which can be used by other disciplines as well. So for example, research in physics, some of the fallouts are, the technical innovations which are used by medicine and many other disciplines. But when we talk of research in Ayurveda, something very interesting happens. So what happens is that there are 3 different ways in which research is done. One is for, should I wait or can I continue? This is Rama factor, something has to happen. I think it's very captivated by my photo there. It doesn't want to leave that. Okay, there you go. Yes. So when we talk about research in Ayurveda, it's a very interesting scenario. So there is work done for validating. Interestingly, a lot of work is also done to contribute to biomedicine. I generally refrain from calling modern medicine because then what is Ayurveda, right? And I also refrain from calling contemporary medicine because Ayurveda works, so whatever works now is a contemporary. So I generally stick to this term biomedicine, which is used basically by sociologists. And then research for the benefit of Ayurveda, for the benefit of the Ayurvedic Vaidyas. Now, before I go into the details of this, I would like to, refresh our memories on the general process that is generally followed in research. So, first is a problem identification, and then you form a hypothesis, questions are asked, and a good hypothesis has to be specific, measurable, and plausible. And then you have the testing. So you use the right methodology, which is in sync with the hypothesis and which is in sync with the problem identified. And here is where one addresses the assumption versus data. And then you have the results and questioning the validity of the results. So where you rule out chance and bias in your results. So then the research is a success. The research is a success not because of results, but because one has followed this rigorous scientific rational procedure of research. Now let us look at each of these. Validation, a contribution to biomedicine, and contribution for the benefit of Ayurveda, and how this process is generally followed. And we need to have in mind that the research question and methodology depends on the objectives. So if validation is the objective, research question is different, the methodology is different. If contribution to biomedicine is the objective, then what questions are addressed, what methodology is followed, they are also different. And if it is something for the benefit of the Ayurvedic Vaidyas, then the questions posed and the methodology adopted have to be different. So let us see what process has to be followed when we talk of validation of Ayurveda. So here is a situation where maybe the non-Ayurvedic fraternity may not agree, but the Ayurvedic Vaidyas and the fraternity know that it works. So we have a system which works, and there are people questioning the validity of it. There are people asking for the evidence. So it has to be done in the context, in the language of modern science and medicine, because it is the scientists and the allopathic doctors who actually are questioning the validity. So unless we speak in their language, they are not going to accept it. So where is the starting point of this research work? So it starts here. So questioning the validity of something that works, that is the starting point. So in the classical sense, there is no problem identification. There is no hypothesis based on the problem. Hence, this step is not there. And there is no testing the methodology based on hypothesis and problems. And so that step is also not there. And the testing to questioning is also not there. But because we have started at the top, there is this process which is followed. So there is a methodology which is followed. And this methodology has to be that of modern science and modern, allopathic medicine. So let us look at the second one. You all may wonder, what is this, is research really being done to contribute to biomedicine? Yes, if you look very closely at some of the research, yes, it is a contribution to modern medicine. And here, the problem identification is done by the allopathic doctors. So they may have a disease for which they do not have a cure, and help is taken from Ayurveda. Or a very typical example is a drug discovery. So they may have a disease for which they do not have drugs, or the drugs they have do not work efficiently. So they take information from Ayurveda, and let's say that there is a plant which has antiviral properties. Then they take it through the regular drug discovery process. They isolate the active principles, and then so there is a problem identification, there is a hypothesis, there is the methodology, and then there is a validity of results. Here, Ayurveda acts as an information provider. Now let us look at the third one, research for the benefit of Ayurveda. In other words, research for the benefit of the Ayurvedic Vaidyas. Here we need to have certain important points in our mind. We need to ask the right questions, and there has to be a zero lag between clinical practice and research. So the clinical practices in Ayurveda are established, right? And so we have our own diagnostic metrics. Based on that, we know what medicines to use. We know what panchakarmas to give or not to give. We know what diet to prescribe. We know what lifestyle activities to prescribe. So the entire package is there, right? So the research has to be in very close sync to this clinical practice, and the research has to adhere to the basic tenets and metrics of Ayurveda. So can we follow the same process? So let me show this with an illustrative example from my own research work. So I will just share a very small part of my results of my research work. So it is in the field of Dravya Guna, what is called as Ayurvedic Pharmacology. We all know that Ayurveda, Dravya Guna prescribes its own parameters, Rasa, Guna, Virya, Vipaka, and I want to take as the illustrative example, just the parameter of Rasa. So we all know that all the Dravyas are classified in terms of Rasa, Guna, Virya, Vipaka, and this slide shows just some examples of medicinal plants which are grouped under Madhura, Amla, Tikta, Kashaya and Katu. Now if you show this list to a botanist, they will say that there is nothing common between the plants which are grouped under sweet or sour or bitter or astringent and pungent. But Ayurveda says there is something common. That's why it has placed them under one group. So what question can we ask? The problem identification. It can be, can rasa-based classification of plants be fingerprinted? What is fingerprinting? Fingerprinting is finding something common in a group of samples. So Ayurvedic acharyas have grouped some plants under a particular category, saying that there is something similar between these. So can we find out what the similarity is? So that can be a question for the starter. And what can be the hypothesis for this? Well, something like rasa is a chemosensory property. So rasa has two aspects to it. One is a chemical aspect, the other is a sensory perception aspect. So we can have this as the hypothesis. And then we can choose the appropriate methodology. if possible, and we can question the validity of results as well. So the methodology can be what is called metabolomics. It is where it's a methodology which is used to find similarities and dissimilarities between samples, group of samples. The techniques I have chosen is NMR, which stands for Nuclear Magnetic Resonance. Incidentally, NMR and MRI, they are the same. It is just that the word nuclear has disturbing connotations in the mind of clinicians and patients. So in a clinical context, the word nuclear has been removed. It is called MRI. Otherwise, NMR is the technique and MRI is part of NMR. So this is NMR spectra from 4 different taste categories. You can see that there is something from the sweet category, Madhura Rasa, Katu Rasa, and bitter, and then you have the Kashaya Rasa. You can say that there are qualitative differences, and which are shown highlighted as well here. So in an NMR spectra, this part of the spectrum gives peaks or what we call resonances from amino acids. And this part of the spectrum gives information about peaks from sugars. And this part of the spectrum gives you information about the secondary metabolites. So now we know that there are qualitative differences, but we need to see whether it reflects in a quantitative analysis. So the analysis that has been used is what is called multivariate analysis. The other thing I want to tell here is how the sample was prepared. The samples were all Swarasas, following the procedures mentioned in Sharangadhara Samhita. So the sample preparation was carried out without deviating from the Ayurvedic principles. There was no disruption of the chemical fabric of the samples. So Swarasas were studied, and this is a very unusual way of doing NMR, because NMR is generally used for single molecules. And in fact, when I started this work, my students who all come from basic science background, they refused to do NMR. They said, "Madam, people will simply laugh at us. People for them are the scientists, And nobody does on a crude sample." I said, "Please don't call it crude extract." I said, "I don't like that word at all. You say Swarasa." And they said, "Madam, it will throw up so many peaks and it will be very difficult to analyze." I said, "What is the point of doing what everybody does? Right? There is no excitement in that at all. Do something nobody does, and do something that people will question. It's good to be questioned." So with great difficulty, I got the students to do these, and you can see that there are so many peaks in this. So by using multivariate analysis, got some very interesting results. Not totally convincing, but yes, it was interesting. So each of the dot that you see here is NMR data from one single plant. So the first graph here shows the plants from sweet category and astringent category, Madhura and Kashaya. You can see that there are 2 different clusters. So what it means is the plants from the sweet category and the plants from the astringent category are different. NMR says that there are differences between these 2 categories of plants. And within the cluster, there are data points. So here, for example, from the astringent, you see all these points here. It means that within the astringent category, there are similarities. So which is called, if we can quantify it, we can say it's a fingerprint. So this figure, if you look at the sweet and astringent group of data, it says clearly that the sweet plants are different from the astringent group, and there are similarities within these groups, but you also see this area of overlap here, this area here. So it means that there are also similarities between the group. Yes, there are differences, but it's not 100%. And you look at this group, pungent and bitter group. Again, you see two clusters. These clusters are not as distinct as you see in the sweet and astringent group, but there are two clusters indicating that plants from the Katu Rasa and plants from the Tikta Rasa are different, and plants within the Katu Rasa there are similarities, and plants within the bitter Tikta Rasa there are similarities. Again, you see an area of overlap which says that there are also similarities between the two groups. Now you look at the sweet and pungent group, the data is dispersed. And these lines that you see here, these the circular outlines and this one, it is drawn more out of wishful thinking. There is no clustering here, but it's what I wanted to see. So don't bother about these outlines, the elliptical and the circular, both are elliptical in shape actually, and there is no clustering. So it means that NMR is not able to differentiate between the sweet and Madhura and Katu Rasa. You look at the Madhura and the Tikta Rasa, it is slightly better than the sweet and pungent. So there are two clusters, but then the data is pretty dispersed. So I was racking my brain as to whether I can improve the data analysis in some way. And so I went back to this classification that Ayurveda has. So all plants in the Madhura Rasa group, they are not homogeneous. So there is a sub-classification based on Virya and Vipaka. So V1 is Shita Virya and Madhura Vipaka, V2 is Ushna Virya and Katu Vipaka, and V3 is Ushna Virya and Madhura Vipaka, interestingly. And then there are gunas. So G1 is Guru and Snigdha, G2 is Lagu and Snigdha, and so on. So what I had done for the analysis, so I had obtained data from the 24 plants, 1 to 24 plants, and when I used the multivariate analysis, I had grouped the entire 24 plants as under Madhura Rasa. So then, with lot of reservations and wondering whether it makes any sense at all, I decided to break this group based on guna. And then I redid the analysis, and very interesting. So you see that the NMR data shows two distinct clusters saying that these two group of plants are different. And what is the differing parameter? It is just guna. So the first group is Madhura Rasa, Shita Virya, Madhura Vipaka, and Guru Snigdha. And then the second one is Madhura Rasa, Shita Virya, Madhura Vipaka, and Lagu Snigdha. The only difference between these two is Lagu and Guru. And you see how it has differentiated the two groups of plants. Now when I use this and reanalyze the data, you see what came out. So what was like this? The sweet and bitter category crystallized to this kind of clusters, very, very distinct, clear-cut differentiation. So when I used guna in addition to rasa, so you see it in the other groups as well. So you see the sweet and pungent group where there was no difference at all when I grouped all the 24 plants together, and then you see how it looked, the data looked when I used the guna as well. and this is for the sweet and sour category. Now the implications are, I personally feel it's very huge, not because it's my work, but I sincerely believe the implications are huge because two important things has come out of this. One is validation of the Ayurvedic classification of plants. The aim of my work is not to validate, but validation has been a fallout of the work. The second is what this could mean for the Ayurvedic Vaidyas. We have a lot of unknown plants. There is no point in telling an Ayurvedic Vaidya that this plant has an anti-diabetic molecule, antipyretic molecule or anti-inflammatory molecule. We need to tell the Vaidya what the Rasa Guna Virya Vipaka is. Otherwise the new plant is of no use to a Ayurvedic Vaidya who does classical treatment. Thus, another aspect is there are the Rasa Guna Virya Vipaka that we follow, that are in the textbooks, have been documented, written down thousands of years ago. Now there are so many changes, environmental changes, there would be genetic modifications. So the Rasa Guna Virya Vipaka, there would be some degradation. We need a way of assessing these. And although I consider this work as preliminary, but I feel that this data is something that one can believe. And I'm very happy to say that Kottakkal Arya Vaidyashala has been part of this work, and Dr. Ramesh Varier has been, whether he likes or not, is the co-PI in all my projects. And I also take this opportunity to thank the funding agency. Dr. Madam Tanuja Nesari is there. She is the CEO of National Medicinal Plant Board. When no funding agency was ready to fund something like this, I was repeatedly told that if you want to isolate active principles and do the work, we will give you funding, but not for this kind of work. There were even some Ayurvedic Vaidyas who said that, you can simply taste it and say, and these are all very redundant properties. Nobody is going to talk of these, and why use a sophisticated technique like NMR to look into these antiquated parameters. And the chairperson of the committee asked me, what would you do if we turn down your proposal? I said, I will put in my money and I will do the work. And if you fund, some of the credit for my work will also go to you. So I said, the choice is yours, what you want to do. But I said, I'm not stopping the work. So NMPB has been, I'm very, very grateful to NMPB for funding this work. Not once, twice. They had given a funding for this project 2 times. So I'm very grateful to them. So did we follow the process of research for work which is in sync with the Ayurvedic tenets? Yes, we had the problem identification, we had the hypothesis, we had the apt methodology, and we also have questioned the validity. I have not shared the data. I have not, for want of time, I have not shared the data with the electronic tongue as well. So when we choose the line of research, be it validation or for helping modern medicine or for Ayurveda, the research question has to be the right one, and the methodology should be the apt one as well. So can there be, what is the research vision for Ayurveda? Can there be one research vision? I would say the way things are being done, it's not possible to have one research vision. Of course, there is the ultimate goal is to get acceptance. From what I understand, the Ayurvedic fraternity wants acceptance from the non-Ayurvedic fraternity and a global acceptance, and making Ayurveda mainstream. Although these are the long-term goals, but there are different processes, different kinds of research that's being done, as I said, validation, and by helping the allopathic system of medicine, and by being answerable to the patients. Ultimately, we can do any amount of research. I can prove in the lab what is Vata, Pitta and Kapha, but if there is no Vaidya to deliver, all these will go down the drain. So we need to be, when we talk about research, we need to prioritize. What do we want to do? Why do we want to do? Who is the audience? And what should be our goals, the long-term goals and the short-term objectives to achieve these goals? What is the methodology to be used? What are the benefits of what we are doing? Whom do we want to collaborate with? And what is the immediate impact? What is the future impact? It is very important to have clarity on these, because patients are dying by the minutes for want of proper treatment. The reasons are many, but one of the reasons is also the limitations that modern medicine, allopathic medicine is facing. So people are looking for, they are not bothered about which pati it is, they want treatment and they want cure. And so whom are we answerable when we do research? Are we answerable to the skeptical scientists and the allopathic doctors, or are we answerable to the patients? This is something that the Ayurvedic fraternity has to decide. And we are using taxpayers' money to do research. So there is a lot of responsibility and accountability that one has to have in mind. So if we have this clarity of thought, I think there is no stopping of Ayurveda, and the question asked and the model that we propose and the method that we use have to be in sync with each other. So thank you very much, and I thank the Kottakkal Arya Vaidyashala and Dr. P.M. Varier for having given me this wonderful opportunity to share some of my thoughts on research in Ayurveda. Thank you very much.
Thank you, ma'am, for sharing the novel informations and ideas. Now may I request our CEO, Dr. G.C. Gopal sir, to honor Dr. Rama Jayasundar presenting a memento. Now it is the time for question and answer session. We request all the speakers to join the dais. We request all the speakers to join the dais, please. We request Dr. Jayadevan sir to take over the session.
Actually, we are supposed to wind up the session by 5:20. We are already late. There are many questions from the audience. I think we'll consider only one or two questions because we are very late. The first question is to Dr. Vijay Kumar sir. So you mentioned that the atherosclerosis can affect even brain, legs, kidney, etc. Is there any chance of affecting atherosclerosis for more than one organ at a time? And there are some sub-questions also you can answer.
Yeah, of course. One patient can have atherosclerotic involvement of many organs at the same time. For example, patient is coming with an MI. Then suppose you are following up this patient for 3 or 4 years. The major important, what we call the MACE, major adverse cardiovascular events included recurrent myocardial infarction, stroke and death. So that means atherosclerotic process once started in any part of the body can affect the other parts. And many patients will have an myocardial infarction, ACS, developing the stroke or the peripheral disease during the same admission. So it is quite possible. The other question, the stent as a foreign body, is there any rejection? Because the stents use a platform called metallic steel, that is 316L, that's a metallic grade of steel. So there is no rejection. And the new platforms are cobalt chromium, which also very much compatible with the biological tissue, so there is no rejection for the stent. Of course, the medicines used in drug-eluting stents, like the polymers and other drugs, they can have some allergic reactions. And antiplatelet treatment for preventive measures. As of now, there is no evidence that giving aspirin for somebody who doesn't have cardiac disease or atherosclerotic involvement of any vessels is not recommended. There is no evidence that that's going to protect the person getting from heart disease or stroke. On the other way, that leads to a lot of side effects like gastrointestinal bleeding and hemorrhage.
Yeah, my question is for Dr. Rama Jayasundar. You had sketched 3 types of researchers. I was wondering about the 4th type, which I think could be legitimate, namely research to find out if the received wisdom is on the right track and where you have to correct it. The history of science is a history of corrections of the prior beliefs and prior ideas of the past. What about refuting some of the beliefs of Ayurveda?
Thank you for the question. What we should understand is that we are talking about a science which has been there for thousands of years. This process of refuting it, challenging the beliefs, all these are inbuilt into the science, which is why the science has come to a stage where it works. We can continue to refute it, we can continue to challenge it, but I personally feel that these processes, we may not have the documentation for it, but we may not have the details of how it was done, but we can take inference. If you look at the Ayurvedic texts which have been, written at different points in time, they are not always the same. There are changes, and these kind of differences, in the text, it will give us an idea about, what has been refuted and what new things have been, taken in. And also, if you read, something like Charaka Samhita, the students there, so that actually is proceedings of a monograph, of a conference. And there are chapters where there's a lot of discussion and challenging which takes place, and the students are always asked to question. So this process of questioning has always been part of our Indian knowledge systems, and there is no reason to believe that Ayurveda would have escaped it. Yes, but we can continue to do it, which is what I think is also being done. So I think Indians don't have to be edged on to keep questioning, especially our own Indian knowledge systems, as Dr. Patwardhan also said. But I think it's important to question. There is no need to be complacent. It needs to be questioned. But I think, that's what I said, we need to prioritize. What is the priority now? It's something that the Ayurvedic fraternity has to think about.
Thank you, madam. Next question is to Dr. Tanuja, madam. Do you really feel that the future of Ayurveda gets a real change on the backdrop of pandemic? If so, please share your views. And also one more question. It is related to diet. What was the diet prescribed for COVID patients?
Yeah, actually, it's a very good question. Basically, now the history will, like we say that pre-Jesus, before Christ and after Christ. So in the healthcare, maybe this would be COVID will be a demarcating line, pre-COVID and post-COVID. So I really feel that the future of Ayurveda after COVID is really bright, because the people have understood the importance of following the holistic principles, preventive, promotion, and also treatment as well. And the future is not only one spati, but it is a complementary and integrative medicine. And what I really feel as like with the experience, what we are doing, because we started with the COVID as an example, but then we realized that the same example why the patient should be deprived for other diseases. So the same what we can say, the model of integrated care, now it is continued to all 200 patients and a second ward, all the wards, and that has become a routine. So I think this is a more standardized, data-oriented, pragmatic, focus approach that has changed. Not only the practices and the services, the products also, everyone has understood. If we really have to stand before everyone, the quality and the safety and the standardization is the must. So the future is the bright. And the last is the diet. Yes, we have prescribed all simple Pathyakar diet, but what very importantly, what we prescribed and gave to each and every patient was Yavago, because we understood this as a jwar, but it was a Swasa and Kas in the phase 2. And in various conditions, it is a Yavago which are used. So in many patients, depending on the condition, the Dashamula Yavago and other Yavagos were also given. Thank you.
So for your question, I think basically the research in Ayurveda, I think arises from the clinical needs. For example, I used to see a lot of patients with hypertension, controlled with 4 or 5 drugs, but still the hypertension is uncontrolled. It's called resistant hypertension. So we were searching whether we can add any Ayurvedic or any plant-derived medication for this particular scenario. Then we searched the Ayurvedic formulary, then found that cardamom, which is a very potent vasodilator, which is a nitric oxide donator in the endothelium. So we thought we'll take a research on that. So we produced some rats with hypertension and tested different doses of cardamom on the hypertension and reversal of the changes which is made in the vasculature, kidney, as well as in the myocardium. And also we could see that the activity of the endothelium in terms of donating nitric oxide, because this is the most important vascular. Any hypertensive medication we are administrating is acting through the nitric oxide. So we could see that this is one add-on drug which we can add with any medicines to control the blood pressure. But it is in the preliminary stage. Now we need to see whether the aqueous, whether the alcoholic, what type of cardamom is useful for that. So I think most of the research now is going to be the clinical need, where some system is not sufficient to support the patient. As she said rightly, it is not the padi, it is not the need of the patient.
I think last question. I think we'll go to the last question. To Madam Rama, Madam. Can we use NMR technique to identify the gradient difference in rasa, guna, etc. of dravyas?
In theory, yes, but in practice, probably not. Because if you are thinking of grading the rasa, what we should be doing is looking at the intensities of the peak and seeing if the grading of rasa shows up as changes in the intensity of the peak. Now, there are so many factors which affect the intensity of the peak. It will be very difficult to separate out the effect of rasa alone. So, as I said, in theory, yes, but in practice, no. But what I am doing and what I have not shown, for want of time, I did not show those results, is my results using e-tongue. So, e-tongue is an instrument which is used to measure the tastes objectively. This is used predominantly in food and beverage industries and tea and coffee industries, just to check the bitterness mainly. And so I have been trying to adapt this e-tongue to measuring the 6 rasas. It has been a Herculean task though, but the gradation can be done using the e-tongue, not with NMR. So I have another question here.
Yes.
The question is, do you really feel that research on the basis of molecular biology is essential for Ayurveda to get global acceptance in modern scientific background? I wish, who asked this question? I wish I was not asked this question, and I was actually thinking maybe I should feel that I don't have this. My very frank answer is no. Let me tell the reason. We are, throughout the world, the mainstream medicine is modern medicine, contemporary medicine or allopathic medicine, and it is run by the multinational pharmaceutical companies. They will never ever allow Ayurveda. Yoga is fine. It's a non-pharmacological intervention. They are not going to allow Ayurveda to, whatever, I may be wrong, I hope I am wrong, whatever evidence you give them, whatever fantastic Nobel Prize winning research you do, whatever receptors you find out, whatever proteins you find out, they will come up with something else. Because there is a lot of money in it, and they are not fools to accept Ayurveda. They may be ready to take appropriate Ayurveda into their food. That they may do. But this is my very frank opinion, and I hope I am wrong. But as a scientist, it is intellectually stimulating to, research on the basis of molecular biology. There is no doubt in my mind that the Ayurvedic treatment, whatever medicines are given, it acts at the molecular level. It has to act. It has to act. How can it not act? Everything is connected in our system. From the atoms to molecules to cell, it's one system that we are talking of. We may have a structural hierarchical model showing, molecules at the lowest fundamental level, and then, as you go up the hierarchy, you can have, cells and organs and whatnot. But all these, let us remember that all these are connected with each other. Any disturbance you give anywhere, you can give a disturbance at the level of molecule, it will have repercussion on the entire patient, right? The allopathic medicines are molecular medicines, right? There is one molecule they give, and then it acts at the level of the patient. Similarly, whatever is given in Ayurveda, it acts at the level of the patient, but it will trickle down to molecule. But it's intellectually stimulating to find what exactly it does. But as far as global acceptance, as I said, I don't think it will work.
Thank you, madam. The message is very clear. I think we can conclude this session because we are already...
I just want to make one more point. See, the proof of the pudding is in eating, right? Can we cure, as madam had so beautifully presented, how classical Ayurvedic treatment was used to treat COVID patients. There is nothing that can be more convincing than this, right? And so my request to the Ayurvedic fraternity is that we are answerable to the patients, and document what you are doing, and that you can have wonderful statistics from it, and nothing else can be more convincing than that. Forget all this molecular biology.
Thank you, madam. I think we can conclude this scientific session. So we had 3 wonderful presentations, and I think I need not comment on this presentation because it was very clear, and especially the first presentation by Vijay Kumar sir was very elaborately he discussed about the coronary artery diseases. Actually, the title was only atherosclerotic coronary disease, but he has covered many other things. There are many non-Ayurvedic persons, all are not professionals here. But I think everyone followed what he said exactly, because all these terms, bypass surgery and stent and all these treatment modalities, all these are very common terms nowadays. All people are assembled here, they know all the terms, technical terms. It's very familiar. So it was very easy to follow, especially he started with the world international scenario to the Indian scenario and all the risk factors and aging and other treatments like angioplasty, etc. Thank you Vijay Kumar sir for the wonderful session. And he also mentioned some Ayurvedic part also, like Ama. He mentioned some Ama. It's very clear that he is still basically an Ayurvedist. He has not forgotten the Ayurvedic terms. Thank you Vijay Kumar sir for the wonderful session. Regarding the second session, the Tanuja madam, I think she has really, it was like a report. She has mentioned all the, exactly all whatever happened in All India Institute. She has mentioned, especially regarding all the initiatives, all the guidelines, all the campaigns, what they have done. They have really done some wonderful work. And of course, they had a support from Patwardhan sir and a very senior team of people, especially Dr. Rajesh Kotecha sir. All of them supported them. And I think it is one of the reason for UK Parliament honoring Dr. Tanuja Nesri with the Vaidyaratnam Award recently. I think the commendable work at the time of pandemic, what she has done, was one of the reasons for getting that award. It is a great recognition by the UK Parliament, and the award name is Vaidyaratnam Award. So congratulations, madam, on behalf of this function. And the activities, the outcome of the activities the All India Institute has done, I think there was a different perspective about the public health, because the public health was always it was monopolized by allopathic people. But now in Kerala also we have done different activities, preventive, curative, and even the post-COVID scenario. So that has made the whole situation to change. And a situation has come where no one can avoid Ayurveda in a public health scenario. That is the greatest achievement after this in this time of post-COVID. It is the commendable work done by the Ayurvedic people in Kerala under the leadership of the Chief Minister. SACRC, a body was formed. Mdct Warrior sir was also a part of that body. It's just like in center what happened exactly. In the state also, we tried to the maximum effort has been taken by the Ayurvedic people to promote Ayurveda in the time of pandemic. So this has made the whole scenario to change, to a very positive change. And you cannot neglect Ayurveda now in the public health scenario. I think that is the greatest achievement happened in this pandemic time. Thank you, madam, for the wonderful presentation. And the last presentation by Rama madam, she has explained the research in Ayurveda with one typical example, an example in a research project which she was involved. It's a typical example in Dravyaguna, how you can do research in Dravyaguna, but that can be a model. You can do different types of research in other areas also. So thank you, madam, for the wonderful deliberation. So with this, I think we can conclude the session. Once again, I remember Kuttiman, and of course, once again I remember him, and the fond memories are really great. എന്നെ സംബന്ധിച്ചിടത്തോളം ഞാൻ തുടക്കത്തിൽ തന്നെ കുട്ടിമാനെ കുറിച്ച് എന്തെങ്കിലും ഒന്ന് പറയാതിരുന്നത്, സത്യം പറഞ്ഞാൽ അത് നാച്ചുറലി ബിക്കം എമോഷണൽ. അതുകൊണ്ടാണ് അതൊന്നും പറയാതിരുന്നത്. എത്രയോ വർഷത്തെ അടുത്ത് കണ്ട ഇവിടെ ഇമ്മീഡിയറ്റ് റിലേറ്റീവ്സിനെ പോലെ തന്നെ, അടുത്ത ബന്ധുക്കളെ പോലെ തന്നെ വളരെ അടുത്ത് നിന്ന് കുട്ടിമാനെ കാണാനും വളരെ വർഷങ്ങളോളം, വളരെ ചെറിയ കുട്ടിയായിരിക്കുന്ന കാലം മുതൽ ഇവിടെ ഇരിക്കുന്നതിലെ ഒരു 90% ആളുകൾക്കും അറിയാം. കുട്ടിമാൻ താമസിക്കുന്നതിൻ്റെ തൊട്ട് ബാക്കിലുള്ള ഒരു വീട്ടിലാണ് ഞാൻ 20 വർഷം ജീവിച്ചത്. അപ്പോൾ നമ്മൾ കുട്ടികളായിരിക്കുന്ന സമയത്ത് ജനലിൽ കൂടെ കുട്ടിമാൻ നോക്കുന്നുണ്ടാവും, കുട്ടിമായും കൂടി നിന്നിട്ട് നമ്മൾ കളിക്കുന്നതൊക്കെ നോക്കുന്നുണ്ടാവും. അപ്പോൾ ആ കാലം മുതലുള്ള വളരെ വളരെ വൈകാരികമായ ഒരു ബന്ധം ആണ് എനിക്ക് കുട്ടിമാനോടായിട്ടുള്ളത്. ഒരു പി കെ വാരിയറില്ലാത്ത ഒരു വർഷം എന്ന് പറയുന്നത് നമ്മളെ സംബന്ധിച്ചിടത്തോളം വേദനിപ്പിക്കുന്ന ഒരൊന്നാണ്. ഒരിക്കൽ കൂടി അദ്ദേഹത്തിൻ്റെ ഓർമ്മയ്ക്ക് മുന്നിൽ സ്മരണാഞ്ജലികൾ അർപ്പിക്കുന്നു. മുരളി സാർ പറഞ്ഞതുപോലെ എന്താ ത്രിപുലയിലൂടെ ഹിമാലയത്തെ കാണാൻ പഠിപ്പിച്ച മഹാഗുരു. എങ്ങനെയാണ് മുരളി സാർ ഇങ്ങനെയൊക്കെ എഴുതാൻ പറ്റുന്നതെന്നാണ് ഞാൻ ഇന്ന് മാതൃഭൂമിയിൽ വന്ന ലേഖനത്തിൽ 2 ലേഖനങ്ങൾ, ഇന്ന് MT വാസുദേവൻ നായർ സാറിൻ്റെയും അതുപോലെ മുരളി സാറിൻ്റെയും ഒരു ലേഖനം വായിച്ചുകൊണ്ടാണ് നമ്മളിന്ന് ദിവസം തുടങ്ങിയത്. എന്തൊരു പ്രയോഗം, എനിക്ക് തോന്നുന്നത് കുട്ടിമാൻ പറഞ്ഞു തന്നൊരു പ്രയോഗമാവും തോന്നും. അങ്ങനെ വന്ന് മുരളി സാറിനെ കൊണ്ട് അങ്ങനെ തോന്നിപ്പിച്ചാവുമെന്ന് ഞാൻ തീർച്ചയായും കരുതുന്നു. ത്രിപുലയിലൂടെ ഹിമാലയത്തെ കാണാൻ പഠിപ്പിച്ച മഹാഗുരു. നമസ്കാരം. കൂടുതലൊന്നും പറയുന്നില്ല. താങ്ക് യു ഫോർ ഗിവിംഗ് മീ ദിസ് ഓപ്പർച്യൂണിറ്റി. താങ്ക് യു.
The technical session completes here. Thank you, sirs and madams. May I request our CEO, GC Gopalapillai sir, to please present a memento to Dr. CV Jayadevan sir as a token of our gratitude. Thank you, sirs. So I request Dr. P.R. Ramesh sir, Chief Clinical Research Department, to propose a vote of thanks. Sir, please.
പ്രൗഢമായ സദസ്സിന് വന്ദനം. കുട്ടിമാമൻ്റെയും വലിയമ്മാമൻ്റെയും ആത്മാക്കൾക്ക് മുൻപിൽ ആദരാഞ്ജലികൾ അർപ്പിച്ചുകൊണ്ട് തുടങ്ങട്ടെ. പേയിങ് ഹൊമേജ് ടു ദ റെസ്പെക്ട്ഫുൾ സോൾസ് ഓഫ് വൈദ്യരത്നം PS Varier and Dr. P K Warrier sir. Respected Managing Trustee, CEO sir, Dr. Bhushan Patwardhanji, Dr. Vijay Kumarji, Dr. Tanuja Nisri madam, Dr. Rama Jayasundarji and Dr. Jayadevan sir. We are extremely happy to conduct this scientific session with the presence and speeches of these eminent personalities. Actually, I think it went on well and it was a very, very enlightening session. Dr. Bhushan Patwardhanji is a chairman and all discussions, all his achievements have been already discussed. I am not going into that details. But what I would like to tell you, Dr. Bhushanji may be remembering the NMI-TLI project where we used to sit with. So at that time, one incident I still remember, Dr. Chopra ji from Pune was deadly against Ayurveda and 350 crores putting in drain. That was the word he used in the first meeting. Whereas after 2 years, after seeing the Guduji platform, Guduji arthritis platform, the most number of Ayurvedic physicians were in his team. He said that actually we should continue the research. So why I am putting that example here? Because we should actually respect the scientists like Bhushanji, Ramaji and all, because Ayurvedic fraternity really need scientists like these people. Not because our collaboration with modern medicine doctors have limitations. They are also practitioners like us. Whereas scientists like Bhushanji and Ramaji, they tell us how this works and what is the new findings. So that really makes us proud, really makes it more evidence-based Ayurveda. And so, the specific mentioning about health is not medicine is a very, very important point that Bhushanji has made today. So, and the holistic approach, being a scientist, the importance of holistic approach specifically sir was mentioning. And I'm extremely thankful, sir. So you have taken all the time. You have preponed your journey from US, came over to Optical and blessed us with your speech. Really, really wonderful, sir. Thank you. Thank you on behalf of Ayurveda Shal. And Dr. Vijay Kumar, sir, I need not tell that actually, sir was my senior when I started in Ayurveda College. But later, he is a person with that much brightness. He pursued his studies in modern medicine and became a cardiologist. And the one important finding sir was mentioning today is the importance of social life and having friendship in the society was one of the factors which helped in reducing the death incidences in cardio. That was a really eye-opening statement that you have made. And I think that in our practice, in our holistic approach, we need to bear this important point in our mind. Thank you, sir, for enlightening us with your very, very important speech. And Tanuja madam, I need not mention, she's actually played a very key role in All India Institute of Ayurveda, New Delhi, into Kowitt Healthcare Center, which we all saw from her slides, where the patients were provided tests and holistic Ayurveda treatment free of cost. And I always see that she is a very dynamic lady, because I've been knowing her for quite some time, because in our NABH meeting she used to come, and when I went for assessment of All India Institute of Ayurveda, madam was there, and in our many discussions in Delhi, we were together. So her dynamism in pursuing things and making things happen is something really extraordinary. So we personally thank you, madam, for taking the pain to come all the way from Delhi to here and bless us. And Rama madam, I need not tell that, because last so many years we were having discussions. So you all know that the way he speaks, way she speaks and way she expresses things, she's entirely different. Her thought process is entirely different. Always when we used to discuss many things, different sparks and different way of thinking, always, that is her peculiarity. I need not tell about other things. And one important factor what she has mentioned, I would like to stress upon that, the attitude of modern medicine towards Ayurveda, which is, according to me also, my experience also is very, very true. I'll just simply mention, I don't want to mention the names. When we were in Delhi, from John Hopkins, Albert Einstein School of Medicine, Arizona School of Medicine, 3-member team came. So we had a lot of discussion. 5 hours they spent in the hospital. We had a lot of discussion. They experienced Ayurvedic treatment and they wanted to know how Ayurveda is really practiced. And we did had a very, very fruitful discussion. But at the in between, it was a private discussion. I put a very simple question, because can you answer very honestly to this question? Because at that time, the COX-2 inhibitor was there in the market, but within 3 years it was withdrawn because of the side effects. So I told them that actually, for example, Chyawanprash in Ayurveda, last so many hundreds of years we are using that, and it is still in the market. We have not withdrawn it from the market. So how do you see this? Can you very, very honestly comment upon that? So they very, very honestly commented that actually, Dr. Ramesh, you should understand one thing. This is true, and we also agree that, but not in public. And then they very, very honestly told me that actually we may not be able to agree this in public, but so that is an attitude, no doubt about that. But I'm not blaming anybody, because modern medicine is an absolutely essential branch of medicine in emergency medicine, and we all do. We also take modern medicine and we respect them. But the attitude what you are mentioning is really true. So just thanking you, because I need not tell anything else. And Dr. Jayadevan sir is my classmate. We have been playing here in Kailasa Mandiram. So I need not thank him, but officially I am thanking you, because his speech, we have seen that his experience in the field of Ayurveda. I need not mention anything. And thanks to officially I am thanking our Managing Trustee and CEO sir also. Thanks for each and every one who have come over here and made this program a great success, especially to the Ayurveda fraternity, Ayurveda students who have, even in this holiday, we were not expecting this much people, but you have come here, and all the teachers from Ayurveda college also who came here. And I thank all the media persons who are here. Thanks for the team who have made it possible, my team. And then thanks to this auditorium, Anashwara Auditorium, light and sound people, the technical people and all. And thank you all once again. Thanks a lot.
We have come to the end of the scientific session held to honor the memories of Dr. P K Warrier sir. Before dispersing, we all invite all of you